Good morning, everyone, and welcome to the Anne Arundel County Board of Health meeting. I'm going to call to order the October 15th, 2024 meeting of the Anne Arundel County Board of Health. Please ensure all phones and electronic devices are set to silence, including mine. And as you can see, we have a quorum, but we don't have all of our council members. There was a little bit of traffic today, which always gets in the way of our 9 a.m. start. I would love to introduce Dr. Tony Gedden, our health officer. You have the floor, and you can introduce your folks as you choose.
Great. Good morning, Tony Gedden, Anne Arundel County Health Officer. Thank you so much for having us this morning. I'd like to start with recognizing the health department staff in the room, starting with Dr. Tope Bada, who is the Deputy Health Officer for Public Health this morning, and also recognizing, although she was unable to be with us this morning, Sean Kane, who is the Deputy Health Officer for Operations. And we'll get right into, I've got a full list of folks behind me, and a bunch of wonderful directors who really put a lot of time and thought into the presentation you'll see today. I have lots of thoughts on how I want to present things, and they are fantastic with, sure, let me see what I can find, up until the last minute. So I really appreciate all the work that they've put into this. Megan Pringle, our Director of Communications, who really has encouraged us to try to think differently a little bit about this presentation. Sandy O'Neill, the Director of Behavioral Health Services. Jennifer Snyder, the Director of Disease Prevention and Management. Don Curdian, the Director of Environmental Health. Peggy Cruz, Director of Family Health Services. Karen Siska-Creel, the Director of School Health Services. Grace Tidings, Director of Finance, and Donna Perkins, the Director of the Office of Assessment and Planning. And in addition to these folks, there are almost 900 wonderful people who work at the health department whose work I'm very excited to tell you about. Couple of key partner agencies, the Mental Health Agency, who's always here to support and answer questions. I'll be presenting on some of their work today. So acknowledging their Executive Director, Adrienne Michler, as well as Dr. Pam Brown, who's the Executive Director for the Anne Arundel County Partnership for Children, Youth, and Families. Just a really quick overview that you all have seen a number of times on the health department. Coming up on 100 years, hopefully in the next 5, and have an operating budget of just over $93 million, budgeted 922 positions, and all of our locations are listed there, but you will see those locations throughout the presentation as it relates to the work that we do. Just a quick reminder, if you are interested or trying to figure out what's guiding our work, our strategic plan, we're still working under the same strategic plan we created in 2022, and we'll continue to work under this strategic plan through 25. But at some point next year, we will start strategic planning again. And so I ask for you all, if there are specific things that you want us to keep in mind, we will do so and try to make that a part of our planning. We appreciate those of you who gave us questions prior to today's presentation, and we hope to be able to answer all of them. So I'm going to do things a little bit differently. It may not come across as super different, but we're working on it. The presentation is a little bit shorter than normal, right? So we've cut it down from about 200 slides to 120. That's still very long, but we do a lot of work. Also, starting with what's new at the top of the presentation, right? So you may see me talk about environmental health up top. Typically, I go bureau by bureau, and that's one that's usually the last one, but I want to make sure that we're highlighting what's new for you all, that you understand what we're working on currently, what's happening in the department, and then get into some of our regular updates. Okay, so I would be remiss in cold and flu season not to start with what's new around our viral respiratory dashboard. As we've moved away from the pandemic and really moved into looking at respiratory illness collectively, right? Not just looking at COVID, but understanding what's happening with flu, what's happening with RSV, and how do those viruses really impact pneumonia and hospitalizations. So this wonderful team has worked to create a tool online, and you can, if you're viewing this or looking at it at a later date, feel free to click the link there. But it really walks through what our numbers are looking like for the county, right? Cases, deaths, hospitalizations, and looking at it again for multiple respiratory illnesses so we really get a full picture of where we are. Our ability to continue to collect wastewaters, I have to thank Department of Public Works for continuing in this partnership with us to make sure that we have an understanding of what levels are, and we're able to test wastewater for the viruses I mentioned. There are also a number of other sources that we're looking at for things like immunization rates throughout the community. So you'll see some of those sources listed here. And this is just a quick snapshot of what you can see on the website. You can not only select the virus of choice, but you can decide which treatment plant you'd like. So if you want to know exactly what's going on in Annapolis, or if you're interested in Broadneck, that information is available to you, and people can kind of plug and play based on what they would like to see. This slide, I think we'll probably continue to present because I think it's important to show where we've been with COVID-19, but where it falls now in the county and the number of deaths that we're seeing and what has happened as a result of the vaccines, treatments, better understanding of a new pathogen. And so we hope to continue to see that number go down. And so far, we're doing a little bit better than 2023. The season is just kicking off. And then hospitalizations. This is the one that we keep probably the closest eye on, thinking of a countywide infrastructure and where we need to be concerned or really start to think about different mitigation efforts from a population health perspective and not just an individual health perspective. This is what we're looking at. And so again, if you're interested in knowing where we are, this information is updated weekly and it is on our website. Also wanted to touch on vaccination rates because we get a lot of requests to vaccinate in different places, and that's changed for us in a few different ways. One of the main changes is the commercialization of vaccines means that the health department does not get COVID-19 vaccines for free anymore, right? We used to get them directly through the state and the federal government, and that changed. So it really kind of puts us in a position of vaccinating the most vulnerable, which is what we were doing prior to the pandemic, but also increasing some of those efforts with things like our homebound residents. But one thing that I really want to note, the percentage of our population that completed their primary series when the vaccines first came out was about 72%. We're seeing about 15% or 16% of folks getting the vaccines now, right? We think it's still critically important that folks are vaccinated. The progress that we see is maintained through vaccinations and treatment. And so just pointing that out because I think it's important that we note it also that it's lower than what we see with flu vaccines, right? People have now, for a year or two, we saw a real flip and there were a lot more folks getting COVID vaccines than flu shots. It has leveled out. And COVID vaccines, the uptick is a little less than flu shots. So we want to make sure that we're reminding folks as you're thinking about your seasonal vaccines, please do get both. You can get both of them at the same time, and we encourage folks to do so if possible. And we didn't want to just focus on COVID, right? Flu has been in existence for a very long time, and people are hospitalized and die from the flu every single year. So wanted to give you a sense of our data for flu. The vaccination data that we have for flu is slightly different because we pull it from a different source. So I can't do some of the demographic breakdowns that I'm able to do with COVID-19, but wanted to give you a sense. Again, we've got about 36% of the county population being vaccinated during flu season. If you'll note, about 16% with the last slide in COVID. And also noting hospitalizations for influenza-like illness and folks going to urgent cares. We know that this time of year will continue to tax our healthcare resources. We don't anticipate seeing cold and flu season kind of go to pre-pandemic levels, right? We have a new virus in circulation, and as it continues to circulate, we will see these increases related to a new pathogen. So just keeping folks aware of what's going on there. And then switching gears. What else is new at the Department of Health? The oral rabies vaccine program. So we've started this year, and I think we get a lot of questions about this program, but also about wild animals in general. So we're going to cover these in a few different ways, but wanted to talk to you a little bit today about how we are informing the public of this program and what it can do. So hopefully this actually works as planned. Let's see. So I want to thank our communications team because we've been spending a lot of time thinking through how to better communicate with the public, how the public wants to receive information, and how we can create short but informative videos or messages for folks, and this is one of them. So short videos like that and other messages, I think, are really crucial to helping the public kind of quickly understand what we do. Even just having a picture of what they're looking at in their communities, I think is helpful. And we've also been able to get a decent amount of news coverage on this program throughout the years that also helps. So this is a picture actually from this year because they're in light purple. So I want to thank the environmental health staff and all of the folks that volunteer with them to really make this happen. It is a heavy lift and a big push, but it's an impressive operation where we're really using the data and also then following up, right, to make sure animals are actually eating the bait and we understand. So we've been able to see over the years since this program's creation a real decrease in rabid animals and rabies. School health, what's new going on with them? A couple of things. We talked a lot in this presentation about our telehealth pilot that was happening in partnership with Total Healthcare and AACPS. This year, as you see, there are dates listed here for additional schools that will be launching with that partnership. We're really excited to see this additional access to care provided to students and working specifically with the Kerwin or community schools to make sure that we're providing this access to those who are most in need. If you have any interest in coming out to any of these dates, some of them are when they are launching. I don't think we have times for each of them just yet, but really working with parents, having Total there as well as the school health staff and school employees to explain what it looks like, what needs to happen. And with the first launch, there were a lot of parents that came out to learn more, to understand what the consent forms look like, what would actually happen with their child during the day. And so we're excited to see this pilot expanding. In addition to that, we're looking at school-based health centers for Anne Arundel County. So just explaining really quickly the difference in a school-based health center and a health room. So right now in Anne Arundel County, we have health rooms that consist of health assistants and nurses. And they do a wonderful job at, we'll get into what they do a little bit later, but providing a lot of much-needed care for students throughout the county. But a health center really allows for what we're doing with the telehealth pilot to actually be brick and mortar in schools, right? Meaning that you would have a nurse practitioner or a physician on site to see children, prescribe medications, diagnose on site. And so the state put out a few grant opportunities for planning grants, and we applied and have been awarded a grant. And so that actually just kicked off on the 10th, the planning for that. We'll continue to keep you all updated, but we're really looking to assess what are the health needs of the county, thinking of students and families, where do we most need resources, and trying to make sure that we have the buy-in of everyone who would be participating in this. Also understanding what model would work best for Anne Arundel County. There's a number of different ways to institute school-based health centers, from hiring the staff directly to contracting out, and so those are things that we will be spending the better part of the next year and a half or so figuring out what this could look like and what we can do to bring school-based health centers to Anne Arundel County. But we will keep you posted on the progress of this group. And again, this one just started on the 10th. Here's just a little bit more about it. We'll be doing some focus groups. We are currently in the process of the community health needs assessment that we do in partnership with several other county agencies as well as our hospital. So we'll be using that data, but also focus groups specifically targeting families in specific neighborhoods to understand what they think we need. And there's a steering committee made up of AACPS staff members, Department of Health staff, and other key stakeholders. Okay, forgot my cannabis bag. I knew I'd forget something this morning. So we'll get into something new that we're doing at the health department is giving out lock bags for folks who are using cannabis. And I had an example to show you all this morning, but we want to make sure with the legalization of cannabis that we're keeping folks safe, particularly those who are not supposed to have access to them. So one of the ways that we're doing that, when I saw the bag, my husband used to work at a bank, and I thought, this looks like a bank bag with money. And they said, oh, no, that's exactly what it is, right, with a new logo and a little key and a lock to it. But a way for parents in particular to keep cannabis away from children. And we're continuing to watch hospitalizations across the county as it relates to cannabis. And we saw a slight increase in 23 prior to legalization. We've seen it come back down, and it's going back up just a bit. So there's, at the bottom right corner, that's actually what the bag looks like. You don't get the full picture of the bag, but it says be safe, be responsible. It has our logo on it, and again, it's about this big, and we hope that it will be really helpful. We've started with a small number, so we've got about 1,000 bags right now, and are working with ways to get them out and where we should be to make sure that these bags are getting to those that need them. But we're working on that, so more to come. And hopefully in the future there will be more bags to give out. If anybody has an interest in seeing one, we'll be sure to do that. And this leads me to one more video I wanted to share with you all really quickly. Again, this is something we are attempting to do more of within the department. This one's about 30 seconds.
Uh-oh.
Right, so I want to thank behavioral health for continuing to think of new and creative ways to protect the public as much as we can and alert people to dangers that maybe they're not thinking of, right? Folks get creative, and we know that there are two different age groups of children that we're concerned about, those who don't know what they're taking and those that do, and making sure that we're actually locking these items up from folks that should not have access to them. Right, and I wanted to talk a little bit about something that our local behavioral health authority, which is inclusive of the Mental Health Agency and the Department of Health with co-chairs Sandy O'Neill and Adrian Michler, the Maryland Consortium on Coordinated Community Services really looks at how we're bringing more behavioral health services to students and meeting their needs. And so as the LBHA for Anne Arundel County, we are a pilot behavioral health hub, meaning as spokes or providers or organizations are selected and awarded, it's really the job of the pilot hub, health hub, to understand what they're doing, help manage those grants. And there's an advisory council that's working on this. You'll see some of the organizations represented on that advisory council on the slide below. This really puts us in an excellent position, we think, as a county to, when it's done with the pilot phase, and we don't know exactly when that will be, to be in place to be the hub to help better organize and implement these services across the county, as we are pretty well informed about the different behavioral health providers in the county and the work that they're doing. And so working very closely with AACPS on this. I have to thank Ryan Vogelin for all of his work and support on this. Something else new that started just a couple of weeks ago. We've talked to you all about our work with maternal and infant health and the task force that we created last November to really look at this issue in Anne Arundel County and determine what we should be doing about it. But one of the things that we've been really clear about and trying to prioritize is centering lived experience of folks who have given birth in the county, and what does that look like? And so we started with listening sessions last year to better understand some of what the community was thinking. From those sessions, we had about a half a dozen residents who were interested in staying on and working with us further on an actual council. And so having an advisory council to inform the work, to brainstorm with us, and to give equal voice to birthing people in the county to make sure that we're hitting the mark correctly. Also to have them as a part of the task force. So as this continues, we will let you know. I'm very excited about the group that we have pulled together for this. They are super engaged, excited. The team and I had some conversations about, like, how do we not scare people off as we wanted to present what this could look like. And then we thought, instead of presenting it to them, like, this is when the meetings will be held, this is where we will be, actually planning that with them. So asking them what they thought, what was a reasonable commitment. And one of the things that someone said is, we need to work together for about 2 years. And I was surprised because I don't know that as a community member, I would sign up for something for 2 years, right? I think, maybe I can give you 6 months, a year tops, but 2 years is a long commitment. But they are really invested in this and felt like we're going to spend the first year building, and we really want to set some parameters and some upfront commitment from the group. And that was really heartening to hear. So as this group continues to move forward, we will keep you posted. We'll be meeting again before the year is out, and then we'll have a regularly scheduled time for meeting next year, and we will come back with more information about that. So into gun violence. What have we been up to in this space? A few different things. Inside of your packets, you will see the first report from the violence interruption program that we instituted in Annapolis earlier this year. Some of what you're seeing on the screen are some of the statistics of what they're doing. There is a database that requires a daily log from the staff members. And so we're able to see, this is what people are working on, these are the areas that they're spending their time, and this would take you April through June. The report for this quarter is actually in the process of being put together right now, so we will be sure to send that to you as well. But wanted you to get an understanding of what they're doing. And a lot of the first couple of months was spent building trust and actually getting people to agree to be participants in the program. And they've been able to do that. I'm really excited about the work that they're doing. Attended a community meeting, maybe not quite a month ago, that was held in the Eastport community. And the turnout from the community was fantastic, but also the things that they had to say about the folks that are doing this work. The team that's on the ground are from Annapolis. Many of them are from Eastport. Folks are familiar with them, and they really just are very passionate about this work. And you can tell. You can tell with their interactions with the community. You can tell by what the community has to say about them. And that is not to say that that the program is without challenges, right? You still have to get people willing to commit to changing, working through things like, where do I put this in the database? We spend a lot of time making sure that everyone understands where things should go, what the documentation means, because we know that we have signed up to do an independent evaluation of this program, and we want their work to be accurately reflected within the database. But there's much more information inside your folders, and we will share the new report when it's ready. One thing I wanted to note, on the right-hand side of my screen, there is 2023 data, and this looks at a 2-mile radius around where we've actually implemented in Eastport. So the number of shootings, so you see assaults, contact shootings, homicides, and robberies in that area. The screen on the left is January through October of this year. So the decrease in dots is a good thing, and we want to continue to see that happening. I think there's a number of things that lead to gun violence, and I also think there are a number of things that lead to a decrease in gun violence. So I don't think that their presence alone is the sole reason that we're seeing this decrease, but I definitely think it plays a role in what we're seeing in this particular neighborhood. And so as the data continues, we will be sure to share, but I feel like this is one of the easiest depictions of what we've seen. Also, when we were looking at where to implement the program, we used maps like these to really drive, okay, where are we actually seeing the types of violence that we think we can interrupt, and using these clusters to make some decisions. And so one of the things that we're going to be working on next is looking at the northern part of the county. So looking at Brooklyn Park, looking at Glen Burnie, and thinking about what would it look like to institute another violence interruption program in that part of the county. When we do similar types of maps for those neighborhoods, we see the data drives us and lets us know that there's enough gun violence happening in those areas that this work could be important. And so 2 months ago, I'm not great with time sometimes, it all feels like a bit of a blur, we had a North County assessment. So this meant that Cure Violence Global, the group whose evidence-based model we follow in Annapolis, came out to do an assessment. They did this probably 3 years ago in Annapolis. They come out, they talk to folks, they walk the neighborhoods, they try to get an understanding of what types of violence are happening in these communities and where there could be potential for interruption. And so this is the kickoff community meeting that you see pictured here. One of the things that I was really pleased about with this particular assessment was the community engagement. There were a number of neighborhood associations and others that came out. They helped to lead the tours through their neighborhoods. As they're walking the neighborhoods, they helped to share their thoughts on where they're seeing violence happening and where they think the violence is coming from. And so I really want to thank this community for coming out and participating in this way. It's really very helpful. And we, as I mentioned, did this assessment based on the violence data that we see, and that's in partnership with the Anne Arundel County Police Department. So this report is actually scheduled to be completed by October 24th. We have a community meeting that evening, and we will be sharing those results with the community. We'll also make sure that they're on our website and that you all get a copy. But it's typically a pretty thorough report of whether or not they have things like government buy-in, whether they have community-based organizations in that neighborhood or in those neighborhoods that could support and do this work. And so as that is released, we'll make sure that you get a copy of that. At this point, we are still looking for funding and thinking of ways to make this happen in the northern part of the county, but we hope to be able to replicate some of what we're seeing in Annapolis City in other parts of the county. Here's a little bit about what the gun violence intervention team has been up to in FY24. If you're not familiar with some of the work and the goals that we had with our strategic plan that was released a few years ago, here's what we're up to. There's a few different things that I would like to make sure that we're paying attention to. The ongoing gun lock distribution, I wouldn't count it as dissimilar to the lockbacks, right? All just thinking of low barrier ways to provide safety within the community. Thinking about extreme risk protective orders and making sure that people still understand those and that we're getting things out, educational materials out for people. And then for the gun locks, we've also expanded who we're working with to get those out. The libraries, again, continue to be tremendous partners and get the vast majority of the gun locks into the community, but we're also working with smaller community-based organizations to do that work. And then providing trainings for the community on adverse community experiences and resilience, right? This is the work we do around gun violence cannot be done without the community. We have to have people engaging and active in this work, and so we're really grateful for all of the feedback that we get there, and also provided a suicide risk letter for seniors this year in partnership with our wonderful folks over at the Department of Aging and Disability. Just wanted to give you a quick snapshot on gun deaths within Anne Arundel County and where we are. So what we're seeing this year for homicides, the rates are lower, but we're seeing suicide kind of staying on track. So one of the things that we will be working on is, and you'll hear more about in this presentation, we have a suicide prevention coordinator within the Department of Health. And we're doing some different things in that space that I hope will continue to kind of cross-pollinate our gun violence work with our suicide work and figuring out some of the best ways to get in front of folks with this topic. Just another quick breakdown on where we're seeing gun violence happening. This gives you a comparison to the city versus the county, and where we're seeing gun violence. This is a quick snapshot of the gun lock distribution and where we are located with the libraries and the communities that are getting the most gun locks. So the darker blue is where you'll see more gun locks distributed. The lighter colors are where you would see fewer gun locks distributed, and some of that would be based on population density, but also the number of locations that we have in any particular area. We initially started this pilot in areas with the most gun violence, but it got so popular so quick that we moved to all the libraries. But this is a pretty good snapshot of what we're seeing. In Anne Arundel County, about 141 residents go to the hospital or emergency room due to a gun-related injury. And about 56% of those are accidental discharges. So we want to make sure that people are storing their weapons appropriately, that they are not in the hands of folks who do not know how to use them, and that people are thinking about safe storage within their homes. And we've just got a couple of organizations listed here that we're working with and are to get the gun locks out. But one of our next steps is to work with a pediatric practice in the county to actually have them giving them out within their offices. And then last but not least here, we had a violence prevention action team grant that focused on the northern part of the county and what we could do. So there's a summary report that's available. I believe that's in your folders. Also an article that was recently published on the work that's happening here, but this also ties really closely into that North County assessment, knowing that there are things that people want to see happening in this part of the county, and what can we do, specifically looking at youth. So these are some of the results of that: community and partnership engagement, evidence and informed programs, policy and system change, specifically related to youth. So we will continue to use this and understand. We had about 78 kids participate and give us their experiences and perceptions of gun violence and violence in the community. And thank you to the county council members who also participated in this process. We are continuing to use this to drive our work and the directions that we're moving in. Okay, this is just a quick snapshot of our June community meeting. Again, the gun violence intervention team has a quarterly community meeting where we're out and about, and we move it throughout the county. Again, it'll be October 24th, so feel free to come out. But on this day, we did a data walk with the community, helping them understand the violence that we're seeing. We also had an update from the Violence Interruption Program in Annapolis, and June is Gun Violence Awareness Month, and we were all in our orange. The Healthy Anne Arundel Coalition continues to move along really nicely and focusing on mental health and obesity within the community. One of the things that I wanted to highlight for today's presentation is something that they've started to work on because we continuously hear about the need to understand what the resources are. And it's not that we don't always have the resources within the county, but people don't know what they are, they can't find them. So Find Help is a tool that allows us to really let people tell us where they are and what they're looking for. And we've had some good success with this. Our community health ambassadors have been trained to use this within the community. Our hospital partners, BWMC, has embedded this within their EHR, so as they are doing things and making referrals within their system, they can look things up. But this is just a snapshot of what we see within the county that people are looking for. So food is the #1 thing that we're seeing from residents, followed by housing. Goods is a very broad category, and health. I don't think most of these things would be a surprise to you all, but just wanted you to know that we are trying our best to get this particular platform out there so people can find what they're looking for and that we have some understanding of what people are needing in the community. Wanted to move into the work that we're doing with our Office of Health Equity and Racial Justice. I think this continues to just be a really nice snapshot of where we are as a county, broken down by zip code and what we're looking to, areas that we particularly target or look to add more work to. This slide, again, gives you a breakdown on education, median income, and population of non-Hispanic Black residents and understanding this overlap that we see in income and education and where we see needing more services happening. Because we have lots of maps like this that we use for a lot of different things, but remembering kind of where these areas light up is important because they also light up for health disparities. There was a specific question, and it's a good one, from Councilwoman Robin around heat-related illnesses and what we're seeing in the county. Climate change is something that we've been thinking quite a bit about within the health department because there are a lot of health-related outcomes to having, as we've seen in the last few weeks, more hurricanes, just hotter temperatures, quite frankly, lead to a lot of increased potential health outcomes for folks. So this is just a snapshot of what we've seen in 2021 through this year, heat-related illnesses, visits specifically for folks. We also are able to see weather-related deaths. We get reports from the state on that. Those numbers are pretty small, so we don't report out on them publicly, but happy to share trends that we're seeing. But you do see this year in 2024, with a good number of days, 90 degrees or higher, we did see an increase of folks going into urgent cares or emergency rooms for heat-related illnesses. So helping people understand how heat and air quality impacts things like asthma or impacts folks with cardiovascular disease. I think we often think about heat stroke, or we think about young children who may or may not be able to, at the point where they can regulate their own body temperatures really well, but there's also a number of chronic diseases that are impacted by really hot weather. And so we want to make sure that we're getting information out to folks on what to do in these situations. Where are cooling centers? What can they do to stay cool? How are they staying hydrated in the weather? We'll keep this coming back to you all. We'll probably do one in the spring related to what we see in the winter time. We do every year have less than 10 typically, but we do have folks in the county who are passing away due to hypothermia. We also had a question about motor vehicle and traffic deaths and injuries. So this is a breakdown, 253 total deaths in the county between 2018 and 2022. About 73% of those were male, 71% were white non-Hispanic males, and 37% were between the ages of 15 and 34. And so there's some additional information here around emergency room visits and hospitalizations related to car accidents and these injuries. And then a little bit on pedestrians. So who do we see that may be being hit by cars versus being in a two-vehicle collision? And then just a bit of a breakdown on the children that we're seeing represented or overrepresented in pedestrian ED visits. If there are any particular questions about these, please let us know, but happy to provide these sorts of breakdowns. So thank you for submitting these questions. Our Health Equity and Racial Justice team continues to hold a monthly Health Equity Forum. You'll see some of the topics listed below that we've covered. It is open to the public and they are recorded, so if you're ever interested in going back to see what we've been up to there, please do. But also please register and join us. These are calls where we're really hoping to increase the bidirectional communication with the community, so not just us telling the community what we're up to, but using it as an opportunity to get their input and their feedback. In addition to our community health workers within this office attending lots of events throughout the county in the last year to make sure that we are well represented and folks know about what's going on at the health department. Our Community Health Ambassadors Program, which is housed within our Office of Health Equity and Racial Justice, we have a number of great partners, 7 to be exact, that are continuing to, just get right to it, educate the community and provide resources. So if you all recall, this is something we started during the pandemic to specifically target communities that we were seeing lower vaccination rates in, and that has morphed. And we're doing a number of different things now. So providing information on how to access care. We actually spend quite a bit of time on behavioral health topics. So they've been trained in Narcan. They've been working on cannabis safety storage. They've been asking for information about alcohol use disorder, right? We know different communities are impacted differently. These community health ambassador groups really focus on our Hispanic community, our Black community, as well as our Korean community. And each community has slightly different needs. And so they're asking us for, here are the things that we need. Can you help us with these areas? Also looking at mental health first aid training. Very excited that not only are they all trained as in mental health first aid and youth mental health first aid that we did last year, but now a number of the groups are also trainers themselves, so we can expand the training that's happening in the county with these community health worker staff that do just phenomenal work. As I mentioned before, we did get the question about heat-related illnesses, but extreme weather preparedness is something we'd actually asked the community health ambassadors to take on last year. We saw it as a need, making sure that we're informing folks of what to do. And we do still go out and make sure that people are educated on the importance of vaccines and get some questions answered. So this is a heavy lift internally to the department, mostly around the trainings. Here's a little bit on what we're training folks on this year and what they're working on. But once that training is done, we're really able to mobilize, and you'll see them at all sorts of events. Most of the things that I attend within the county, I see one of our partners there some way, somehow, and they do just really great work in a way that I think as a department it would be difficult for us to do because we are a governmental entity, right? These organizations are familiar to folks. They are familiar with culture and language, and I think having these folks trained to share these messages are as trusted voices makes a difference. Here's just a little bit more about what they've been up to this year, the number of folks that they've reached, the number of community and educational events they've attended and held themselves, and the mental health first aid trainings. We're very excited about that, and we hope that this will help many communities have better understanding of what to do when you're seeing someone in crisis and how to handle that and what to do next, when to call for help in particular. Okay. Following that behavioral health theme, I spoke a little bit earlier about our local behavioral health authority, but wanted to make sure everybody understands exactly what an LBHA is. Sometimes we get very caught up in the acronyms and we stop and we're like, does everybody know exactly what this entity is doing? Probably not. But this is a partnership between the Mental Health Agency and the Department of Health, and it really oversees and helps develop plans for a comprehensive public health, behavioral health system, and they do a phenomenal job at it. This year we had their monthly provider meetings that happen, again, started during the pandemic, but we found it really useful to keep those going, to engage with providers, to understand what their needs are, to share information with them, but also to hold things like symposiums, where we're able to get a lot of behavioral health providers together, provide education to them, talk to them about plans for the county, engage them in planning opportunities. And so we're excited to see this continuing. We continue to see a good number of providers showing up to that meeting every single month and asking wonderful questions, and we continue to see new providers join that call. So folks who might have just started working in the county or have opened up a new organization, the word is still getting out and they're joining us, which is great. So we start to create connections amongst the folks working in this space, but also with us directly so that they can ask questions and reach out. Okay, here's just a little bit on the priorities and strategies for our LBHA. And then I will get into exactly what's going on with behavioral health. A couple different things happening in behavioral health, and I know you all are familiar with our Wellmobile, so here's just a quick snapshot on the numbers of folks that we're serving on the Wellmobile. And what we're really excited about is those who, the Wellmobile is meant to be a place to start your care, right? It's not meant to be the final stop. It's meant to connect you with community providers and to provide a place for that care until we can do so. So really excited when we see 79% of folks keeping their initial appointments, right? That means that we've been able to either touch base with you physically on the Wellmobile or via telehealth services for the county, and then folks are continuing to follow up with their much-needed care. Some of the things that we offer, we've incorporated STI and HIV testing, naloxone distribution, syringe services, and wound care. For those who may not be familiar, some of the injectable drugs can leave really not so great wounds on folks, and we want to make sure that they're actually getting those cared for, assessed, and hoping that people will seek further medical attention for those wounds. But I think it's a really great way to make sure that we are not losing people to unnecessary infections, and that we're getting those treated, and that they're going somewhere, hopefully, where they feel comfortable, where they are not facing some of the stigma that we have folks reporting of reasons that they don't go into healthcare institutions. Oftentimes is how they feel that they are treated when they're there. So we hope that we're providing a welcoming and inclusive space. So I wanted to talk about a lot of the different things we're doing with the overdose prevention team. And so you'll note a name change that happened with the state this year, one that we were actually already in the process of doing, but it helps when we're all aligned and doing it at the same time. So no longer the opioid prevention team, but looking at all types of overdoses, right? We know that we find opioids in lots of different drugs, even for those who may not be intending to take them, and we don't want anyone to hear the name of the group and think, oh, this one's not for me because I don't use that particular substance, right? We want to make sure that folks are getting these messages and are engaging in this work. And so the OPT for the county includes government entities, community organizations, people in recovery, family members of people in recovery or people actively using. And so the goal here is really to reduce overdoses, and things that we're able to do with this, public service announcements, similar to the ones that you've seen, or others where we're actually engaging the community to talk about their lived experience again. And I think those hit differently than hearing me talk about it, right? When you hear folks who have had this experience talking about what they've done or what recovery means to them or where they are in their recovery now, hopefully speaks to people in a different way. We wanted to make sure you all saw what's happening with overdoses in the county, and this is not just in Anne Arundel County. We are seeing trends heading this way, but very excited to see opioid overdoses decreasing and fatal overdoses decreasing as well. We do think that a good part of that is due to naloxone and having it readily available and being distributed to people, and 4 out of 5 fatal overdoses did not receive naloxone, right? So we know we haven't reached everybody yet, but we hope with things like our vending machines, our Wellmobile, community health ambassadors, and just so many other partners and folks working in the space to get it out there, that we will continue to see fatal overdoses go down and all overdoses continue to decrease. So this is a positive change that we're really excited to share with you all, and we hope to see that trend continue. I just mentioned some of what we're doing to hopefully decrease those trends. The harm reduction work is critical to this. We created a harm reduction advisory council, and that council is made up of community partners, county agencies, but also people who are still actively using. And that is a tough group to say, hey, can you sit down and talk to us about what's happening with you right now? But I really want to applaud behavioral health for not giving up on having that group represented and having folks around the table to share what can actually happen. And I don't really know who better to tell us what to do as it relates to overdoses than people who are actively using. And so I want to thank that whole advisory council for their work. And they also have a report that was released in March. So our Health to Go vending machines. I shared these machines with you for the first time at our last meeting. I think we previewed them probably this time last year. But excited to see that we've released, and I'm sure at this point we've crossed the 2,000 mark for Narcan kits dispensed, fentanyl test strips, xylazine test strips, and COVID-19 tests that we've been distributing in those machines. Just as a quick reminder, they are in both of the correction facilities, the Severn Center, Brooklyn Park and Deal libraries within the Glen Burnie Health Center, and our health department headquarters, as well as in Eastport in the community center for the Housing Authority of Annapolis City. So we're excited to continue to see people taking advantage of these machines and getting what they need. Right. Other data that we see, these are a couple of different programs, all kind of similar vein, but different things. So overdose survivor outreach is really important. We have peer specialists who are really scheduled 7 days a week to try to reach out to anyone who has experienced an overdose. So this gives you a little bit on our success in doing that. We reach out to everyone, so 100% attempts to outreach. We make contact with about 45% of folks, and then about 32% are actually linked to treatment. But again, this is 7 days a week that they are out there, and excited to see this, excited to see 32% of folks actually being linked to treatment following an overdose. It's important that we reach out and try to engage quickly. Syringe services, there's a little breakdown on referrals that have been made and clean materials that have been distributed throughout the community, as well as our overdose response program. This is making sure that we're training folks with Narcan, anyone. So if you're interested in being trained, there are ways to reach out to us at the health department to come out and do that, but it will train you on what are the signs and symptoms of an overdose and how to administer naloxone and what to do until help arrives. Something I wanted to make sure we highlighted today, because this is new data from the Youth Risk Behavior Survey that the CDC releases every 2 years, I believe. And this is specific to Anne Arundel County, right? It looks at what we're seeing happening with students. So we're seeing a decrease. There's a couple of things on the slides. The measure, so currently drinking alcohol, for example, what percentage of students say that they are currently drinking, whether or not that is a change since 2018, and then if we have a disproportionate impact. So for instance, 12th graders are saying that they're drinking alcohol at about a 33% rate compared to other students. And we also see a higher rate of white non-Hispanic students at 25% drinking alcohol. And so these are, as you look through each of these slides, it'll tell you who may be disproportionately impacted the different direction, but we're excited to see that the youth within the county have decreased some of this. Again, knowing that this data is about 2 years old now, trends change, so we'll keep that information coming back to you. But we'll have a couple more slides throughout the presentation that highlight what we're seeing with youth specifically. I mentioned earlier that we had a suicide prevention coordinator, and this year we held what we hope will be an annual suicide prevention summit. It was really engaging, great to have folks out, wonderful sessions, and you see all the staff there in purple. There's a swarm of purple people, not people eaters, but out doing these presentations and organizing it. And so behavioral health did a great job with that summit. What you see below is a little representation from the mental health agency as well as the health department at the Out of Darkness Walk for suicide prevention. So again, just trying to make sure that we're engaging the community. This is relatively not new that we're focusing on suicide, but that we actually have a staff member who is out and about doing so. She's down there at the bottom right, Desi. Thank you for all the work that you're doing in this space, but also making sure we're training the community. Another exciting development that came through last week is that the Supreme Court declined to take up the appeal related to the literature for suicide prevention in gun shops. And so we wanted to make sure you all understood the number of pamphlets that had been distributed between April of 22 and July of this year, and a little bit about the compliance visits that are happening. So as we've gone out to visit to see whether or not the materials are available and they're being handed out to customers, most of the retailers have been compliant. We've gone out and seen 3 that were not, and they are in compliance now with reinspection, and the others really businesses that are closing. So maybe a small gun shop isn't open anymore, or it's changing ownership, those sorts of things. But so far, for the most part, we're seeing compliance across the county, and we hope that it will be helping. Youth mental health is a topic that we hear absolutely everywhere. And so I wanted to touch on a little bit, same survey, the Youth Risk Behavior Survey, of what we're seeing, and again, different groups that may be disproportionately impacted. So we are seeing an increase in students reporting feeling sad or hopeless every day for 2 or more weeks in a row. We're not seeing a particular change in those considering attempting suicide, and we are seeing a slight decrease in kids reporting that they were bullied on school property. We do, however, in this category definitely see kind of a trend of our LGBTQ students being disproportionately impacted, female students, and then depending on the category, sometimes different racial and ethnic groups also having a different impact. But this is important for us to remember as we're thinking about the mental health of youth in the county. And just I'm going to do a quick overview of the Mental Health Agency. I never do it complete justice, but I have no doubt there will be questions for Adrian to come up and join us. I'm going to jump right into it. So crisis response. One of the things in preparing for this presentation and talking with Adrian, having folks understand the number of calls that are dispatched after business hours, right? So about 40% of these calls are happening later in the evening. And that's really important for the work that these staff members are doing and how we are supporting the crisis warm line. Because it is 24/7, 365. And then what we are seeing is also that after people have engaged with the system, that there is a real difference in preventing a crisis, right? So we think about, okay, I need these particular services, something is going on, and folks access it. But whether or not that continues to grow, right? If their crisis continues to get worse, if it gets bigger, and what we see is if we're engaging really early on, it doesn't have to hit those elevated levels of need and acuity for folks. And so that is very important. As I just mentioned, the demands for children's services continue to be high. There's a bit of a leveling off. So we saw through the pandemic just numbers that crisis had never seen before. The leveling off of the numbers is happening, but the acuity continues to be high. So the amount of time each case is taking, the amount of resources that each individual needs is still very high. Here's just a quick snapshot on the number of folks served in various areas and the work that they're doing. I think it's important that we continue to show the trends over time of what they've been seeing. So warm line calls and mobile crisis team dispatches. So as I mentioned earlier, we do see that things have leveled out a bit, but are still higher than they were pre-pandemic, and the acuity is higher. Looking at children, we have seen some of the needs for children come down, but they remain high in 2024, and the year's not quite over. We're hoping that the work with the consortium and other coordinated efforts to get more mental health services in the community for children will continue to impact these numbers. Okay, and mental health stabilization services. So responds to the school and to the community to assist youth and their families with crisis. Here's just a little bit on the average intensity of the behavior and the average perception of the problem, right? These things are important to understand as we look at where folks start and then where they're ending in their time. So patients reported a 48% decrease in the intensity of behavior. So if you're looking at this from week 1 at a 126 down to week 8 at 66, that's important that people feel like it's getting better. The parental perception on how the problem is being handled and or how it's presenting in their homes. We also see a very similar change in their perceptions on the problem. And then the crisis intervention team challenges. We are still seeing the CIT team doing more assessments than they did before. The demand for CIT has increased. And then in partnership with the police, really thinking about the decrease that we've had to make related to the number of officers available. Officers are rotated through as well as the ones who are actually assigned. But, you know, as with anything else, the more you do something, the better you are at it. So it's not that the other officers are not fantastic, but you get more experience and you get more team cohesion when you have folks assigned. And so I know this is a challenge that they are continuing to navigate and working through, but just wanted to know that this is some of what crisis is working through. And also having to cap the number of new cases based on availability of officers. Okay, just a little bit of the mental health agency out and about. And then I'm going to move into disease prevention and management within the health department. One of the things that we've seen this year that we have not seen since pre-pandemic was an increase in pertussis or whooping cough. And this is important for a couple of different reasons. Really young children and older adults are at high risk, but we also want to make sure that folks are being vaccinated. Particularly adults. So if you haven't had a Tdap vaccine in a while, it's not a bad thing to stop and ask and make sure you see the numbers here, those that are less than a year old, those that are between the ages of like 1 and 19, and then those that are over 20. So it's important for adult vaccinations. We know that a number of the children may not have been eligible for vaccination. Some were not up to date, and we want to make sure that folks are taking advantage of those. And so it is cyclical at times that we will see these increases, but as you see, we haven't seen numbers quite like this since 2018. So I wanted to make sure you all were aware. And this is statewide, it is not specific to Anne Arundel County only. Okay. Other things we wanted to talk about, I'm going to skip that slide and move into our Healthy Communities program. So this is the combination of what used to be COVID operations and our previously existing immunization program. And so now it really gives us two arms, right? We have the community health centers, and then we have mobile services. So this is a breakdown of what we've been able to do in those various spaces. We've been able to serve many more people within our community health centers because we're actually able to operate them now 5 days a week. There are about roughly 12 staff members, I believe. I'll let Jen Snyder correct me if I'm wrong on that one, that were increased after the pandemic, right? At our height, we were probably at maybe 200 employees that had been added to the health department. About 12 of those folks have actually allowed us to operate all of the health centers 5 days a week. Previously, we were rotating days, so we're here on Monday, we're at another site on Tuesday. So we've been able to increase the number of vaccinations and services provided, but also keeping up with the vaccinations in the community. So vaccinating our homebound residents, working in senior centers, working in homeless shelters, recovery houses, and providing that information. And as I just mentioned, we've administered things like Tdap that help prevent whooping cough. And other vaccines to rising 7th graders. Wanted to make sure that everyone's aware, and I think we've talked about the fact that we do continue to see increases in syphilis. So we are performing Hep C testing, HIV testing, and rapid syphilis testing, distributing safe sex kits, and answering phone calls. And I did want to touch on what we're seeing in the youth. On a positive note, we're seeing less sexual intercourse reported from Anne Arundel County students, public school students, but unfortunately we're also seeing a decrease in their use of condoms. Looking at about 48% of students saying that they are using condoms. We see a disproportionately lower number in Black non-Hispanic students, and so we want to make sure that we're getting these messages out, because while we start to see an increase in sexually transmitted infections, I don't think we're totally surprised to see a decrease in condom use. But what does that mean, and what do we need to do to work on that? our cancer screening program, I will not read this full slide, but as October is Breast Cancer Awareness Month, we do want to highlight, and if anyone has ideas, we're looking to increase the number of Black women that we're screening through our cancer screening program. We know that while they have lower rates of breast cancer, they are more likely to die or be diagnosed late stage. And so if folks have thoughts on ways that we can continue to outreach that population, please let us know. But here's a little breakdown on what we're able to do from breast and cervical cancer, clinical breast exams, mammograms, and also lung cancer screenings. We have that available now. So I think that's one that people are getting more and more familiar with, but we want to make sure that that's happening. We had a question about animal care and control and its relationship to the health department. So I wanted to spend a little time, and it's specifically nestled here within disease prevention and management, but also there's an overlap with our environmental health work as well. So one of the things that I think is most important to kind of remember in differentiating the two is that at the health department, we have expertise in humans and human diseases, right? One of the things that we work and rely on our animal care and control friends to do is if there is an animal, it's like, oh, okay, they're presenting this way. I can't help you on how to assess if your dog is presenting strange, right? Those are things that we have to reach out to veterinary folks for also. So the actual care of animals and how animals are presenting is really their lane. And then for us, it's how are we protecting humans? And that there's a couple of different things that we do as a result of that. If there is a human bite, for instance, there are orders from the health department that can order an animal to be quarantined. So the Office of Animal Control and Care will carry that order out. They go out and check on the animal. It's their role to see how things are going with the animal. We are checking on the person that has experienced the bite. What are their symptoms? Do they have the appropriate medications and treatments? And we also provide, and this is where environmental health comes in, as we talk about ORV and having different treatments specifically for rabies vaccines. And also we provide rabies vaccines for animal control to inoculate pets. So there's a couple of different overlaps there. We also do public notifications. So you'll see if you follow us on social media, there are lots of raccoon and bat alerts on a pretty regular basis. Something that I don't think most folks know that we do is we license and inspect pet stores. I didn't know before I took the job. But if you have exotic birds, you have to make sure that you are handling those appropriately. And so if you go to PetSmart and you see a parakeet, the health department has been in to make sure that it has been appropriately stored and that they're treating it appropriately. So those are just a couple of the things that we're doing, also making sure that post-exposure treatment is happening for residents. I hope that answers some of the questions, but I'm happy to answer more specific questions as we wrap up. Just a little bit on the Brooklyn Park Healthy Food Pantry. This was always intended to be an effort that we wanted to have a community organization lead at some point. We are moving towards that. So as that progresses, we will let you know. It definitely took a pause during the pandemic. It wasn't a top priority to get that out, and it really would have been a tough time, as we all know that food resources were more in demand than we've probably ever seen. So we're working on finding a community partner to take that over. Okay, I'm gonna move a little quickly through some of these. Infant mortality, we'll continue to highlight with all of our presentations. I think these are very important numbers for what we're seeing, but I wanted to make sure that we got specifically to what we learned during the listening sessions and what we've learned so far, and some of the things, again, that we're doing to try to communicate with the public. So this is an unfortunate picture of me with my mouth hanging open, but we were really excited and fortunate to do a town hall with Radio 1, where we reached over 12,000 residents. They have the ability to target people in the county and say, we're gonna try to put this in front of you. So this was, I was like, what is a StreamYard? It's really just a fancy word for a Zoom. But this is a StreamYard that I was able to participate in. And I will say the most important person on this panel is Ms. Powell, who's in the bottom right, who shared her experience of child loss and preeclampsia. right? Her story, I think, and educating folks on what that looks like, what the symptoms are, what they should be doing and advocating is so critical. But also we have to get the word out to folks. And so this is just one of the ways that we were able to do that. And I want to thank our communications director for continuing to navigate these sorts of important partnerships. But what we've learned is that people want to know more about what can go wrong during pregnancy. So education and awareness, barriers to accessing care, cultural sensitivity while care is being provided. A lot of folks want to know, what are providers trained on, right? Do they have bias training? Is this something that's instituted? The inability to make prenatal care visits. So thinking about when you call to schedule, how long does it take for you to get that first appointment or follow-up appointments? And then postpartum mental health has been really, really important. We've actually talked a lot about postpartum mental health, but we haven't talked as much about what it looks like during the pregnancy and the mental health challenges that people are facing there. So this is just a little bit of what we've learned as we did those listening sessions, but as we also continue to collect information. We have very small business cards that if you're interested in giving us your feedback, there's a QR code that you can scan, and it's continuously on our website for us to collect information from the public on what they think we should be doing and their barriers. I wanted to share good news from our asthma and lead program. There's two arms to this, and I'll only cover asthma today for time's sake. But the goal for this program, when it was instituted 2 years ago, was based on 2018 data that children under the age of 19 required emergency interventions at a rate of 7.2 per 1,000 for asthma-related complications. We wanted to get that down by 20% by 2026, and we are well on our way to doing so. We've seen a decrease by 19%, so we're 1% away, and we've got a little over a year, so I hope that we're actually able to surpass that goal and continue to decrease the visits that we're seeing for some of our most high-risk children who are continually in the hospital. So conducting 608 home visits throughout the last fiscal year, talking about ways to reduce exposures, ways to reduce triggers for asthma. And we do see that Black children are requiring emergency care about double the rate of the general population. So again, looking at those disparities and figuring out how we can continue to have an impact. Here's just a little bit on where we are seeing asthma emergency room visits throughout the county. So again, the darker areas are where we're seeing higher rates. Lower rates are shown in the lighter colors. And then just a little bit about those enrolled in the program. Dental services. The dental sealant program. Still very excited that we are able to partner with AACPS to do this. We are applying sealants to third grade students at 19 community schools. We hope to be able to keep up with the change in the number of community schools that we see every year, but I'm putting that out there because we've talked to ACPS about it. But we know it means that we need more staff. And it can be a challenge in local government to hire a dentist, hygienist, and dental assistants. There's a lot of demand for them in a lot of different places. I'm sure many of you struggled to get into your dentist office during the pandemic. We've seen a lot of folks leave the field, and so making sure that we're competitive is important for those to make sure we're continuing to provide these much needed services in the schools. REACH is a program that we talk about a lot because residents often ask us, how do we get more REACH services? Where can we have more REACH? I think this one is a real community partnership and requires providers to want to sign on and to be a part of this program, where we are, for folks who are uninsurable, entering into agreements with providers to see them at a low or no cost rate. And that can be a challenge, but our team does a wonderful job of providing the care coordination and the additional support that a lot of these residents need as they're navigating sometimes a new country, navigating language barriers. Our staff are here to help limit some of that and to help coordinate that care and help those offices who have agreed to see our clients. I'll move really quickly through this one. One of the things that we saw at the end of the pandemic, that people had to renew their medical assistance eligibility as they did pre-pandemic. We have seen a real serious increase in the number of folks coming in, so about 131% increase, which means that we've had to do some things differently. We've had to alter our workflows, increase hours. So I really want to thank the staff who have changed what they're doing, how they're doing it, and when they're doing it to make sure that we're meeting the need of residents. And that came accompanied with the Healthy Babies Equity Act, which we're very excited to see. And we see folks taking advantage of that. So for pregnant people who are ineligible, they are eligible or normally ineligible for insurance, being eligible during pregnancy. We saw a little over 1,000 applicants. And school health. This one gives you a lot of numbers, but I think they're very important numbers on how many total health room visits we're seeing in the county. So just over 625,000 visits. We're giving out over 150,000 medications to students, having a number of conferences, providing education, home visits, treatments performed. These numbers really speak to the work that they're doing each and every day. And I want to make sure that I talk about how we are trying to remove barriers in keeping children in school, right? We want to make sure through things like telehealth, through planning for school-based health centers, and many of the other things that we offer, that hopefully it provides the access that parents need and children need to keep them in school on a regular basis and keep them healthy. This year, the young lady you see in the front suffered a cardiac arrest at school. And we've had 2 students in the last year with this. So there was recognition for our nurse, Elizabeth Carey, who was the person who responded to this, along with the resource officers in the school to provide CPR. The parents actually requested it. The child's name is Vanessa. But they requested that this happen, and it happened at the school board meeting 2 to 3 weeks ago. So it was really fantastic to be able to acknowledge the great work that they do. And one of the things that I don't think either of them really wanted to be there. The student or the nurse are both like, do we have to do this? And I can imagine being in the 9th grade, it's a bit much. But one of the things that I learned that speaks volumes about the relationships we create is that they eat lunch together every day. Since then, the nurse and the student, they've developed a relationship, and they are continuing to get to know one another. And so their bond, I think, or I hope, is really special and important. And then something new that's coming, Vision to Learn. So a pilot program, and you all may have received invitations from ACPS, who's working to increase Vision to Learn, which provides things like, we do vision screenings and hearing screenings in schools. And then our goal is to really make sure that if you need a comprehensive eye exam, that you get that done. This provides that comprehensive eye exam and eyeglasses. So we really hope that this program is able to get off the ground in Anne Arundel County. They're providing services in other counties in the state, and they do a wonderful job. And then just one other note of House Bill 86, which requires school nurse and a designated trained school personnel to stock bronchodilators in the school for people experiencing respiratory distress or asthma-related complications. So we are in compliance with this, but wanted everyone to know. And then environmental health. Here's just a little bit about what we're doing to license food service facilities. Almost 5,000 inspections, routine inspections, and unannounced inspections where folks know here we're coming out. But also things like food trucks and licensing them for events. There's a lot of work that happens. The summer is a very busy time for this group, and they really do good work to try to make sure everyone is kept healthy and that people are serving things that will not pose a danger. Environmental health always has the best pictures. This is one that we hear from you all on a regular basis, rodent control, and this particular program, so just so you know, this is the number of properties that was selected and surveyed from June to October, pesticide services that were completed and referrals, property assessments that were performed, and then there were 955 violations. Some properties have multiple violations depending on what you have going on. And then in 2023, just a reminder that we expanded some of our services into Annapolis City. It's just a little bit about our well and septic program. We also get questions from you all about this program on a regular basis. So there are 4,800 or 48,000 properties that are served by private well in the county, 41,000 by on-site disposal systems. And I think we had a question about how many do we know are not performing well? And that's not really a thing that we know in advance. It would be great to know whose septic system is about to go out, but we don't really know that. So that's something that we wait on residents to let us know as they find out that something is wrong with their system. We do have things available and resources available for folks to offset some of that cost. We do see that the cost for materials has increased over the years. And so what we're seeing is not that there are necessarily more failing systems, but that it costs more to fix one system than it used to. And that is the end of my presentation, and I'll stop for questions.
Thank you so much. It's always a pleasure to have you, and your presentation is always incredibly thorough. The work that y'all do is truly stunning. Are there questions of my colleagues? Ms. Hummer.
I have a couple of questions. I, like you, did not know that y'all did bird inspections. So when you go to pet stores, are y'all only looking at the birds, or do y'all look at pet stores overall?
So it's exotic birds specifically that we are, because of the different diseases that they can carry.
Okay, that's fascinating. I didn't know that. And then when it comes to rodent inspections, do y'all do rodent inspections on any property? So like an apartment complex or a business, or will you also do them on private property?
So yes, we will do them really anywhere we're getting a complaint. There's a couple of nuances to being able to actually access a private property and what we can see, right? We have to have the owners sign off on that or be able to see it from. So if I can like stand on the street and I can see that you have trash here and I can see a rat versus I'm going to look for burrows or that sort of thing, is really just depends on whether or not the property owner is open to that. But yes,
But you could come out if, and at least visually take a look at places, okay? And I think that there's many great things y'all have in there, but I think the decline in overdoses is really phenomenal, and that's a great move forward. I'd love seeing that. So thank you for all your efforts to get Narcan and other things out to the public. Thank you.
thank you.
Mr. Smith.
Thank you, Madam Chair. I'm just a simple plug for, love the work for the REC. It's a program. It's a rodent, whatever the title is, but just plug in Brooklyn Park is probably one of the #1 complaints I get in that area is trash and rodent issues up there. So the more we can do up there to help those residents, I certainly would be great. Greatly appreciate that.
Absolutely.
Thank you.
One of the things that we work on heavily is education, because there are some things that people just don't realize will attract rodents, like animal feces. So if you have a pet that may be using your yard, like those sorts of things attract animals or rodents. And so if you're thinking about like trash, like I don't have any trash back here, but you have pet waste, those sorts of things are things that we want to get out to the public so that they better understand. And if homeowners are agreeable to us coming on properties, we're happy to inspect that sort of thing and give them that feedback.
Ms. Radvian.
Thank you. I have a whole I have a whole bunch of things, but I really wanted to start out with some just really positive feedback. So many of the metrics of the data that you guys are showing us are moving in an encouraging direction. So I just wanted to give you a shout out for all the work that you're doing, because to me that looks like an overall improvement of the health in our county in so many ways. So thank you for doing that. I was especially encouraged by the progress of the Gun Violence Intervention Task Force, or the Violence Interruption Program. those maps of Eastport and surrounding areas just speak volumes. I mean, you went from so many of the dots of the different colors to just so many fewer, and that, you know, is a huge quality of life. I know that it had gotten pretty concerning in, you know, particularly in the Eastport area in late 2023 and early 2024, but your work started and it seems to be making a huge difference. Obviously, like you said, there's always factors, but I don't see how this one couldn't be one of them. I love the telehealth program. That's just amazing, you know, reaching people that might otherwise not get, you know, get the services they need. So many good things. So I have a couple questions too. And most of them are just informational to sort of follow up on things that you provided or information you provided. One of the questions, that flu or the virus dashboard looks really cool. I look forward to taking a look at that. But I noticed, you know, we've seen definitely a decrease in the number of COVID-related deaths, but, and I imagine that it's on there, although I think you said you're using different data sources, so it might not be apples to apples. But do we see, now that COVID has sort of settled into a more, I don't know, a more just normal? I don't know if COVID will ever feel normal, but is it on par? Are the number of fatalities related to COVID in the same ballpark, or is the flu more causing more deaths?
That is a great question, and I believe, I'll double check this, but I believe we actually now see more flu deaths, but I'll double check that and we'll get back to you.
Okay.
It's one, we'll have to check the sources for, I'll have to talk to Donna. Donna Perkins is our Office of Assessment and Planning
and
Director.
she's waving.
There you go. But she is our data guru.
Okay.
And so if we have specific data questions, unless Donna, do you want to answer to that one? Off the top of your head?
Top of my head, I'll have to go back and check. I also would just say, it varies by flu season, by severity too.
That makes sense because it's never quite the same. And then the, you know, effectiveness of the vaccine is, you know, I know they do their best to make it match what they see coming down the pike, but it's not all, it's not all an exact science. I was just curious with the oral rabies vaccine, are you using working with the police department and using their helicopter?
Yes, we are still using the helicopter, and the team, I'm not sure if, sometimes I think the team might be like MacGyver in disguise, but they've created things to clean the fish meal off some of the packets, because at one point we were really making a mess of the
inside of the helicopter?
Yeah. So trying to be better partners. And so there's this contraption, one day we'll put it in the Board of Health slides, but that they've rigged up to make sure that we are getting the excess off of there and not leaving the helicopter smelling like fish, but yes.
Well, I love to see that you guys are able to partner with the police department for that use. And I appreciate that the police department is working with you to help that, you know, aspect of community health. Let's see. Oh, community schools. So I love to see that program is growing. That obviously has such a huge impact on young people's ability to learn if they're healthy. I just still always think of the child running out of my classroom screaming who'd been, you know, acting up all hours, and then I realized, oh, he had a horrible toothache and was just miserably in pain. And so those kind of things just absolutely have an impact. And so I'm really grateful to see that you know, is expanding. I was curious, do the community schools, do they provide services for parents as well, and if not, is that something in the future? And what does Kerwin or the blueprint say on that front?
So yes and no. Right.
Okay.
So during school hours, for instance, the telehealth program right now is not providing access to parents. But one of the things that's talked about at the launch for each school is that they can see your family. Right. So while they're serving the child that day in that moment, total health care is making sure that folks understand where they are, what they can offer, that they can see the entire family. And they are working to get a mobile program up and running as well. So I think in the future, we may be able to actually see the ability to access both. At the same time, the New Village Academy has been thinking through what that could look like to actually have a clinic that's both serving students and the public simultaneously. And that model does exist in some places. It's difficult to retrofit some spaces, right? Because to get into a school, you've got to provide a decent amount of ID and what are you here for? And so having spaces where there can be multiple entrances and exits and ways to keep children safe make it a little difficult to put it just anywhere, but these are conversations that the community school leadership has had with the health department, and something I think as we move through the planning for school-based health centers that we should be seriously considering.
Yeah, and that's definitely one advantage that New Village Academy would have at the mall, is that there are lots of vacant spaces, so it's, easy to come up with space there, so that's great. Let's see, okay, with respect to behavioral health for youth, I'm curious if there is a way, and it looked like you brought in lots of different community partners to participate in those conversations, and I was curious if there are young people involved in those conversations, or if you need to, if there are, because I think the county actually, I think there's a ton of different, sort of entities within the school system that, could provide young people to give input, because like you said, a lot of the work that you do really depends on that communication going both ways. And so, hearing directly from youth, if it's not already in your model, I just wanted to throw that out there. It sounds like it might be, but so I wanted to just ask about that.
Yeah, I'm gonna call Sandy O'Neill, our Director of Behavioral Health, up to give us some more specifics on that. I do think it can be a challenge at times, depending on when we're hosting meetings, but I agree with you, making sure that we've got a youth voice in particular.
There we go. Hi, Sandy O'Neill, Director of Behavioral Health, Department of Health. I think there's always more opportunity. We do include youth when we can. Nothing about us without us, of course. Most recently, we've been working with them to get feedback on different types of communication and encouraging them to help us with our marketing materials and things like that. But we are absolutely, along with the Mental Health Agency, having conversations about how can we bring them in even further back into our planning. So you're absolutely right. That's an important area and one we have some opportunity for growth.
That's awesome. It sounds like you're already in that area, though, which is really fantastic. Related to, so thank you. With respect to heat-related illnesses, obviously this is just something I've been watching. By spending a lot of time talking about gas-powered leaf blowers over the past few months, I spent a lot of energy looking at climate change and different impacts of climate change, and one of them I noticed was an increase in heat-related illnesses. And the data that you provided, you had heat-related illnesses, definitely increasing over the last few years. Is that data from this summer? Is that record? Or I don't know how far back your data goes on that. I'm just curious. It certainly looked like it was going upward, but I don't know if that trend, is, if that is a long-term trend and if this was a record year, not in the positive way of a record.
Yeah, so I think the data we presented today goes back to 2021. I would have to see how far back we could go with that, and I'm not sure that we have the records to say if this was a record-breaking year or not. I don't know if Donna is telling me in the back, which
I can see her hand.
Okay. But that's something we can look into and see. We definitely are seeing a trend of them increasing, and I think as we continue to see more days in the state where it's over 90 degrees for days and days in a row, we will continue to see this happening.
Yeah. Oh, cool. Well, thank you for responding to that particular request for information. Okay, I promise I just have two more because I know we've got a full morning of bills after this as well. I realize it's only middle of October, but I'm curious, or just something that I would ask that maybe you look at is the impact of the school cell phone policy change with respect to youth mental health, because I know that has, cell phone use, the what do you call it, doom scrolling, and online bullying and things like that can really have a pretty detrimental impact on young people. And so, we're only, like a month and a half or maybe about 2 months into the school year, but I'm very curious to see if that has any impact. I would expect that it would, but, data is where it's at on that kind of thing. And then my very last question is, you mentioned the mental health stabilization services, and I don't know that I've heard of that before, and wondering if I had I apologize, didn't remember, but I would love to hear more about exactly what that is, how someone gets connected to those services, and the like.
Yeah, I'll actually invite Adrian Michler up to speak a little bit about what that looks like. To your right.
Good morning. Adrienne Michler, Director of Mental Health Agency. Sure, our MHSS program is an 8-week program. The referral process is through the DSS or our crisis response system. It is an in-home program, and it is a duration of 8 weeks. It is intensive services, and the graphs you saw were scales that are used throughout the process, and you can see the outcomes are extremely favorable as far as the perception of the problem and the intensities of the behavior. So that's the referral process.
I appreciate that information. I will try and share that with constituents where appropriate.
Ms. Fiedler.
Thank you, Madam Chair. Thank you for the presentation. It was very thorough, as always. I will try to whip through my questions because I know we have an agenda ahead of us. So the cannabis hospitalization numbers, are you also tracking any potential correlation with those hospitalizations and then mental health case volumes increasing? Because I know we talked about this the last time you were here, that introduction of cannabis, especially with developing brains, can have a negative impact as far as mental health or triggering an underlying mental health undiagnosed condition. So I'm just curious if we're seeing any correlation or even tracking that information.
Yeah, that is not one at this time that we are tracking. I'd have to look to see if it's possible. One of the things that generally can be a challenge with the data that we have via the emergency rooms or hospital visits is that we are reliant on folks to give their health history, and sometimes mental health is not a part of that, right? They're asked, but whether or not people, and so our ability to connect the dots or to say that one is related to the other or correlate them together is sometimes a challenge. So I can't say that we know specifically at this point. I think that maybe, and it may be something that's hard to look at from a county perspective, but I'll definitely ask the state that question with the way that they look at trends and pull data together. Oftentimes they may see something earlier than we do.
Okay. I'm going to stay in kind of the same area of questioning. Looking at the motor vehicle death and injury data, purely anecdotal, but it has seemed like in the past year, maybe even the past 6 months, we have had a significant amount of fatality accidents that have resulted in fatalities, especially with motorcycles. Are we seeing any of those numbers suggesting impairment in those accidents, and are they related to cannabis or are they related to other substances? I know that the technology, as far as I know, is not quite there to test drivers on the scene for cannabis impairment, but it does exist also anecdotally. Driving on Route 2, there was someone going 15 miles per hour and weaving, and go next to them, and there's smoke in the car, and you can pick up an odor, but there's no testing available. So are we tracking the number of accidents with potential cannabis impairment?
Not to my knowledge. I'm not sure that that data source exists, but I will double check and see what's possible for us to pull. And I'm not sure, have to figure out which pieces of that are in the health record and whether or not people are tested versus what's in police reports.
Right.
And so sometimes if you're not tested, we don't collect police data to then tell us what happened with someone's hospitalization record. So it may exist separately in different ways, but I don't believe at this moment we know that specific to cannabis.
I appreciate that. I mean, we have spent decades talking about drinking and driving and the dangers of drinking and driving. So I think we can't leave out other intoxicating substances, especially cannabis. Really quickly, you touched on the safe sex kits in schools and the decrease in teens using condoms. Is the health department still offering the cards for information in health rooms in the schools?
We are.
Okay, that's the method that students are using. Are you seeing a change in students reaching out?
Not to my knowledge. I don't believe we've seen an increase or decrease. I believe it's about the same. I think this year, based on the slide, we gave out about 1,500 safe sex kits overall. So that's the whole county, anyone calling and looking for one. We were able to do, but I don't believe we've seen a particular increase or decrease in schools.
In schools. Okay. And then staying in the same school line of questioning, the mental health slide showed numbers for non-Hispanic populations, females, and LGBT, but there weren't any male-specific numbers. Would you be able to provide that information?
Yeah, we
Okay.
specifically pulled out, so if this is the average, here are populations where we're seeing a negative disparity. So the numbers exist for male students. It's just that if you didn't see them listed on the right side, that we didn't notice any particular disparity or marked difference in their presentation versus that of the average. But we do have those numbers. And that full report is available from the CDC. So we'll be sure that we can send out the full report and you can.
That would be great. And I'm asking specifically for males because we know when we look at school violent incidents across the country, it tends to be male students who have been struggling with a variety of issues, including mental health. So I'd be interested in seeing those numbers. With regard to student mental health, are we pursuing any strong initiatives for peer support training? I know I've mentioned in the past the Yellow Tulip Project, but there are a variety of projects and peer support training options available. Are we doing that actively in the county or with the school system?
That's a question I'd have to redirect to the school system. We are not at this moment, but I could find out if there's something happening within the school system specifically.
Okay, I encourage anybody who's interested to look into the Yellow Tulip Project. It has worked wonders and had an immense impact in school systems that have struggled with high suicide ideology thoughts and high suicide rates in teens. So I think it's something important that we should pursue in the county. And then finally, this is my last question, talking about postpartum health. Do we have any information or is there any public or private wraparound care offered for those mothers who have had a high-risk pregnancy and maybe are dealing with some postpartum anxieties as a result of that high-risk pregnancy and the stress and anxiety that it causes? I know of one private offering in the county, but I didn't know if we have that information readily available. I know you mentioned the mother who had preeclampsia in the slide. I don't know if she talked on that in your Zoom meeting or what options are available.
Yeah, so as a part of the Maternal and Infant Health Task Force, we do have behavioral health represented there. So those who specifically are focusing on postpartum care and those who are generally providing behavioral health and thinking about what are these overlaps within the county. I'm not aware of any public resource at this time that provides exactly what you're speaking of for families, but I can look into that. We've had a couple of different presentations to the task force as we're thinking through this because it's such a big question. Providers want to know, like, oh, I made the referral, but did they actually go? Does this person specialize in postpartum care? And so understanding what those resources are in the county is one of the things that the task force is working on in our asset mapping. So I'll let you know exactly what we come up with. But I do think we're not quite meeting the mark for folks, and that there's more that we need to do in this space, but I'll let you know what we find.
Great, thank you. I appreciate that.
Are there any questions for Dr. Geddens or her team this morning? I think that concludes our sitting as the Board of Health. I want to again thank you on behalf of the council for being here and everyone on your team. We are incredibly grateful for the work that y'all do. Have a great day.
You too.
Is there any other business to be brought before the Board of Health? May I have a motion to adjourn? Is there a second?
Second.
All in favor?
Aye.
The motion carries. The Anne Arundel County Board of Health is adjourned until May. At this time, are you? Okay. We're going to try to get through at least one bill before my colleague needs to leave. Mr. Volke, remind me of what your bill is, number. We're going to start this morning our work session with Bill. Well, I should call the work session to order. But we're going to start with Bill 7724 this morning. We have representatives from the police department here to, right? So, Mr. Volke, you have the floor.
Great. Thank you, Madam Chair. Thank you, Madam Chair. Appreciate you accommodating the need for me to move to another meeting soon. So we do have some representatives from the police department here. Mr. Hunt, I'll go first and then I'll turn it over to you and then you all can add comments. So this bill creates a distinction between two types of towers. It creates a light duty tower and a heavy duty tower. Light duty towers are more along the lines of what you would think when you see a car accident and the police department has to dispatch out somebody to deal with clearing the intersection or clearing the roadway because there's been an accident and there's a tower there. But a heavy duty tower would be something where you have some sort of apparatus, whether it's a vehicle, whether it's a boat, whether it's a really difficult situation that may require specialized equipment to be able to remove the apparatus from the location that it's in. I've heard stories about people being off into the water and needing heavy duty towers. You're talking about big buses. The police department can certainly go into a lot more detail on this. With that, one of the concerns is that there is a tow rotation, and so when the police do reach out and say to the towers, hey, we've got a tow, can you do it? There is no distinction between the heavy duty and the light duty tow list, so all the towers are in this rotation. So you will get towers who do not have the capacity to handle these heavy duty tows being requested to come out and do the tow. The issue with that is it's time, right? Everything is just time. And so as a result, as they go through the tow list and the police department goes through their procedure, they're talking to tow companies who can't actually do the work that needs to happen. And sometimes what has happened, and I think Corporal Grover, you may be able to touch on this more, there are sometimes light duty towers who then have sort of sub deals with other towers who have the capacity to do the work, which is then kind of defeating the purpose of this rotation and how this is supposed to work. So the whole purpose with this is to establish these two different lists, one for light duty towers who can do most of the things the police department calls on them to do, the other for heavy duty towers who have more of the specialized equipment. It creates requirements for what that equipment would be. The police department will maintain the list of who is on each of those different tow lists, and then the police department will determine at dispatch whether it's a light or a heavy-duty tow, and then they'll be able to dispatch the appropriate towers, hopefully allowing these situations to be cleared up more quickly. That's my understanding of the bill. If I got anything wrong, I know you guys will correct me. You are the subject matter experts, so I just want to thank the police department for being here.
Thank you, Madam Chair. Ethan Hunt for the administration. With me at the table, I have Captain Tim Schultz from the Police Department, Lieutenant Aaron Brand, and Corporal Jamie Grover, who have been working with the sponsor of this legislation for several months to hash out some of the details. So I think they are the subject matter experts, so I can turn it over to them if they want to add anything, and we're happy to answer any questions.
Did you want to add anything?
There are, in reference to this, we are, for one, in support of it, and Corporal Grover has been involved in this program, our towing program, for many, many years. We met yesterday, and I myself, just being new to the unit, coming back to special operations after being separated for quite a while, became very familiar with how this towing program works, and it was a great summation of how the light duty towing program works. But this request is something that Corporal Grover has been working on for quite some time. It is an issue, and it is something we'd like to see come to fruition. It's something that would add efficiency not only for us, but for those people out there that have been involved in an accident, and it would absolutely clear up roads in a much more timely fashion. So the one request that we have, I'm actually going to allow either the lieutenant or Corporal Grover to go over one of the requests that we would like to, or maybe amendments or changes that we're looking at now, because as we discussed this yesterday, I think it would expand where we are right now as far as it looks at maybe there's about 5 towers that have this capacity, the way it's written now with 2 heavy-duty vehicles, and we'd like to talk about maybe moving that down to 1.
So I'll expand a little bit more, so Lieutenant Aaron Brandt, my apologies, I also was recently transferred into the Special Operations Division Traffic Safety Section, so I am learning all of the things that Corporal Grover has been dealing with in and out for several years now. But from a commander's perspective and from operational perspective, we understand the desire to have the 2 heavy-duty tow trucks versus the 1, because it's the 1 is none mentality. The police department gets the redundancy. The concern with that is that we would limit the number of tow programs that would be eligible to participate as a heavy-duty in that rotation. So we would cut the number of tow companies that are eligible to participate, being able to call in their services, because not every tow company has 2 tow trucks. They are very expensive for these heavy-duty tow trucks. So it is a financial burden on our businesses to make that requirement. The way that the Artura program works for the automatic responses, they divide everything up, kind of like the legislative districts. Each tow company represents a particular area. So geographically, if a crash happens in one area, there's a designated tow company. If that tow company were to be out of service for one reason or another, because they only had 1 tow truck and it was down, the system would be notified, and then it would make adjustments to call in other tow companies, not just by the response area, the tow areas that border it, but there's GPS tracking in the tow companies' vehicles. So when they're in service, the system would actually know, all right, well, tow company A, it's not their area, but they happen to have a truck that's in service that's close to this area, and be able to dispatch the closest tow by GPS. Therefore, cutting down that response time from maybe the tow company closer on the other border that may be at the far side of their region. They may not be the closest. So the system has a lot of things that are in place to help with that redundancy. So it would allow more companies to participate and make it more efficient. Also, I'm not sure how the interpretation of the wording is, but when I read the section on the additional standards in 11-16-201, it talks about possessing at least 2 tow trucks capable of conducting heavy-duty towing registered by the State Motor Vehicle Administration, and then in the brackets, that are capable of performing normal towing operations in a safe and timely manner. I'm not sure if they have 2 and then 1 goes down, does that then put that entire company out of service because they no longer have 2 tow trucks on that particular day that are capable of performing normal towing operations in a safe and timely manner? Does that then eliminate that company that has 2? So then reducing the number of tow companies even more. I'm not sure if that's just the way I'm interpreting it, if everyone would interpret it that way, if it's something that could be cleaned up in the language, if we do elect to go forward in requiring those 2 tow trucks. But allowing more, this allows a lot more flexibility if we reduce it to the 1 tow truck that is meeting the standards that we're looking at. And I know there are some criteria in what defines the heavy-duty tow truck. Some of the definition would allow just for a tow truck to be considered heavy-duty, even if it's just for like a specialty vehicle. So the 5th wheel trucks that need to be towed would need a specialty tow truck, but that a towing truck that is capable of doing that may not be big enough to tow some of the heavier equipment. So if the company only has the 1 specialty tow truck, it classifies, quote, as a heavy-duty tow, but it may not meet all of the needs of some of the heavy-duty tow requirements that we have on scenes. And I'll let Corporal Grover explain a little bit more if I missed anything. Okay.
Are there any questions of my colleagues, further comments, Mr. Wilkie?
I'll just add, I'm very happy to work with you all on amendments. So if you have these and you want to sort of work with me and with the Office of Law on what exactly we need to do in the bill, that's fine. I don't have any issue with that. I know this is something that we had a bit of a work group and we didn't identify these issues, but that doesn't mean that we are the only ones who can see any issues with these pieces of legislation when they come out. So appreciate the feedback and certainly happy to keep working with you on it. So thanks.
Ms. Fiedler.
Thank you, Madam Chair. One quick question. If a non-large towing company suddenly gets one or two, whatever number we end up with, is there an application process, or how does that issuance piece of the bill get triggered?
I'm not understanding the question.
So if one of the smaller tow companies that doesn't have the equipment for larger size tows suddenly gets one piece of equipment or two, as the bill is currently written, there's an issuance provision in the code. But what triggers that issuance? Does the company that now has these vehicles capable of a large tow
Yes.
apply?
Yes, they would
Okay.
have to apply, they would have to get inspected, and then be issued a license.
Okay, perfect. Thank you.
Thank you.
Thank you. We'll move forward with Bill 7324. This is an administration bill. Mr. Hunt, when you're ready, you have the floor.
Thank you, Madam Chair. Ethan Hunt for the administration and Lori Blair Klossmeyer from the Office of Law. This is a very straightforward bill. This is for the Carrollton Manor Special Community Benefits District, and this simply amends the purpose of the district to allow them to acquire property. I believe there's a piece of property that the community association wants to acquire.
Are there any questions of my colleagues? Okay. We were slated to take a small break in between the Board of Health and starting this work session, and I know I need a quick break. Does anyone else need a break? Okay, we are going to break for just a minute. We've been sitting since 9, so we will recess for about 5 to 7 minutes, and we'll be back to pick up with 7424 farm dual uses. So you can read your notes. We're going to get started again. Pardon the quick break there, Mr. Hunt. 7424?
Certainly. So Bill 7424, sorry, Ethan Hunt for the administration. I have Lynn Miller from the Office of Planning and Zoning and Lori Blair Klossmeyer from the Office of Law. Bill 7424 makes a revision to the zoning certificate of use requirements for farm dual use, which was adopted by 6223 last year. And this is to address a comment and recommendation from the Critical Area Commission. Happy to answer any questions.
Do we have any questions regarding Bill 7424?
One quick one.
Yes.
This was supported by the Ag Commission, is my understanding, correct?
Yes.
Thank you.
Okay. Moving through the agenda, Bill number 7524, mixed use districts. This is also an administration bill. You have the floor.
Thank you. Ethan Hunt again for the administration. Lynn Miller is with me from Planning and Zoning, and Kelly Kenny from the Office of Law. So Bill 7524 proposes new mixed-use districts covering a range of purposes that can be applied to future mixed-use sites. It also remaps existing mixed-use sites to the new districts, but grandfathers any existing sites that are still in the development process so that they can proceed under the current code if they choose to do so. And I'm going to turn it over to Lynn to discuss in more detail and explain some of the amendments that will probably be coming forward at the next meeting because we got feedback from stakeholders after the bill was introduced.
Oh, okay.
Hi, Lynn Miller, Planning and Zoning. So as Mr. Hunt mentioned, the intent of this bill was, there was a couple of things. We wanted to improve on some of the requirements for mixed use that are currently in the code that have been hanging up some of the development projects over the years. The primary one being the specific percentage requirements for the different land use categories. Developers haven't had great luck working with that, and as you all know, there's actually been 2 or 3 text amendments passed over recent years to try to provide some relief from those. So that was one intent, and then we also wanted just to create a range of mixed-use categories that might be more applicable to some of the new sites that are coming out of our region planning process. So with that, we did put a bill out in the summer. We got actually sort of minimal feedback. After we had drafted the bill and introduced it, we got some more feedback from some of our stakeholder groups, including NAOP and MBIA and GAN. So we are working on several amendments to the bill that I think, or I hope, are going to reach a better consensus with some of those groups. We're meeting with some of them later this week. And if we get agreement, we're going to try to have the amendments ready by Friday. I don't know whether that's going to be in time to get them in on Monday or not, but either way, we're going to try to have them ready this week. Some of the things we're talking about doing, there's a few tweaks that we're going to make to section 177604, which are the development design standards. I don't think those are too substantive. They're sort of some wordsmithing type changes that some of the constituents were interested in. We are going to add, when you get to Title 8 and Article 18, we are going to add some purpose and intent statements. Some of the stakeholders thought those would be helpful. We did too. We actually didn't include those initially because we don't have any purpose and intent statements in Article 18 right now. We used to, and they were removed in the 2005 code update. I'm not even really sure why they were removed, but we actually find them helpful. So we're planning to reintroduce purpose and intent statements when we get the opportunity to do our Article 18 cleanup bill. So we were going to hold that until then, but for this particular bill, I think it's going to be helpful. So we have drafted some that will maybe help users understand the intended difference between the 5 new mixed-use districts. We are also going to thinking about adding a provision that would basically grandfather any existing uses that would no longer be permitted uses in the new use chart so that they wouldn't be non-conforming. And this is something we did last year with the Odenton Town Center plan because that use chart was revamped as well. So that's potentially going to be an amendment. We have a number of adjustments in the use chart that I think we want to propose that will make it a little more in sync with the purpose and intent of each of the 5 districts. We also are, I think, going to add a provision that's in the code now that this is a provision that allows for a mixed-use project that is within the airport noise zone or that's on a former reclamation site to have some more flexibility in terms of uses. That's in the code now. We hadn't included it because we actually weren't sure that provision was still needed by any of the mixed-use developments that are out there, but we got some comments that some stakeholders would like for that to stay in the code, so I think we will put that back in. We may make some adjustments to the bulk charts. We're still talking about that. I'm going to see how that meeting goes later this week. And then we may also, there's a provision related to the BWI Fort Meade growth area that is in the code now that we need to, I think we need to add that back in with some adjustments. That's a change that was added per bill, is it 2024 that passed earlier this year? That the purpose of that bill was to allow mixed-use sites that are within the BWI Fort Meade area to be relieved from the mixed-use requirements. And I think it also gave them a higher allowable density. And so we need to, assuming that the intent of this council is to keep that in place, I think we're going to reinsert that back into this bill. Having said that, that may change next year when the Housing Attainability Act comes into place. That may not, that specific clause may or may not still be needed. I think we can figure that out as we get closer to the effective date of the Housing Attainability Act. So that was sort of a lot, sorry, but these are the amendments that I think we've got a fairly good level of consensus on based on our stakeholder feedback. But again, we are still having some discussions later this week. So we'll know more by the end of the week.
Okay, so those are, that's a lot of potential amendments. That would be, you know, the first public hearing is Monday. We just got the legislative summary late yesterday afternoon as a council, so I don't know where everyone is in their own review of this bill, but it sounds like there's a lot that is still moving. I'm going to take a moment. Well, Ms. Fiedler, why don't you go ahead?
Thank you, Madam Chair. I have several questions on section 31205 of the bill. This provides for an administrative rezoning action. We have always talked about, as members of the council, there are two ways that you can have your property rezoned, and that's by council vote during comprehensive rezoning and through the administrative hearing officer. Is this the administratively rezoned? Is that going before the administrative hearing officer, and it's not an approval through the department, correct?
That's correct. That would be an administrative rezoning granted by the administrative hearing officer.
Okay. May I continue with follow-up questions?
You may.
So I did reach out to Mr. Hunt to ask some questions about a specific area of Region 4 that I think is the only area that would qualify under the very specific language of this section, because it says that the property would have a mixed-use planned land use, but that they would not have the mixed-use zoning. And that was exactly what happened in the center of Severna Park, where we rezoned it to commercial. It's an existing zone. The intent behind that amendment, because it did include an amendment to the actual planning document, was that there would be a study, there would be involvement from the community. It would almost, I envisioned it wouldn't happen again until comprehensive rezoning took place. But now we've kind of carved out the opportunity for this to change again. Was there a specific reason? Is there a specific project that's being held up?
Well, first of all, there's a provision in Article 18 now that says that a property can't be rezoned to a mixed-use zone unless it's already designated for mixed use on a land use plan, whether that's in the GDP, a small area plan, or region plan, whatever. So that's in the code now. I think it hasn't really been used much, and that may be because of the rules of construction and the change or mistake requirements. So the intent of putting that clause into this bill is because, as you know, this bill wasn't going to be adopted and effective in time for all of the potential proposed zoning changes through the region plan process to be able to take advantage of it. And there were some parties that felt like we didn't necessarily want all the sites to have to wait 8 or 10 more years till another round of comp zoning came through for them to be able to achieve mixed use zoning if they were planned as such on a land use plan. So that's why this was added to this bill. It, of course, doesn't guarantee that they would get a rezoning. They would still have to meet the criteria for or the findings that the hearing officer has to demonstrate for a rezoning. So there's no guarantee, but it at least opens the avenue for some of these sites that have been planned for mixed use and who don't want to wait for the next comp zoning to come in and try to apply for it through administrative rezoning. I do understand your concern, though, about the specific site that you're talking about and wanting to have a planning study in place. We can't obviously guarantee what a hearing officer's decision might be. I would think that if we have an adopted plan that specifically says we want to see a planning study in place before that property is rezoned, I believe the hearing officer would give that weight if there were an application in to rezone it. But of course, we can't guarantee that. And to your other point, no, that is not the only site that is planned for mixed use but not rezoned. There are others. So there are other, which was really why we put this into the bill, because there are several of them. And some people felt like they might not want to have to wait till the next comp zoning.
Follow-up question. The several that would not want to wait, I would assume they were in one of the first 3 regions that we've completed?
Yes, they are. Excuse me. There are a few in Region 2 that were planned for mixed use, not rezoned. I'm actually seeing 1, 2, 3, 4 sites. Actually, sorry, 3. One of them was actually rezoned to mixed T. That was the Annapolis Junction site, but there are 3 others that were planned and not zoned yet. That doesn't necessarily mean they might all come in and try to get rezoned. Some of them, their intention may have been to wait till the next comp zoning. Others, it may not have been. And then in Region 4, there are, in addition to the site that you were concerned about, which was the Severna Park Marketplace, there are 2 others that were planned but not rezoned. Then there are a handful of others where it was discussed, but they ended up getting a village center overlay, which is different from mixed use on a land use plan. So that clause wouldn't apply to them.
Okay. Would it be possible to get the full list of properties that would fall into this category that have already been through the rezoning process? So Region 4.
2, 4, and 7.
Yes.
Right. There were no new mixed use sites in Region 7, so it's
Okay,
really
so just 2 and 4. Yeah, that would be very helpful.
Okay.
Thank you.
Racetrack. Ms. Ledbetter.
Thank you, Madam Chair. This is going to be probably very simple. I just want to make sure I'm connecting all the dots properly. So when I'm looking at, it's in the 18-2105, where it renames the existing districts, gives them new names. So once the new name is applied, the permitted uses would update to what's in the updated permitted use chart, correct?
For an existing mixed use site?
Right, so for an existing mixed use
Yeah.
site that it's currently mixed use R, and it's going to change to neighborhood, then the new permitted uses are what is in this bill, in the chart.
Right. So if an existing site had not come in with a development application yet, if they had done nothing with their mixed use zoning, and they came in with an application, then they would be working through the process under the new bill. So the new requirements, the new use chart, et cetera. All of our existing mixed use sites, I believe, which is 11, well, one was just rezoned, so 10, are pretty far along in the development process. In other words, none of them would be starting from scratch. So the grandfathering language in the bill would allow them to continue under the current code. So I think that will work for them, but that's something else I think we're going to be discussing this week to make sure that that does work. So they would have the option of being grandfathered and continuing their project under the current code. Or if they wanted to, if they say have some remaining phases that they were going to come in with a new plan for, they could do that under the new bill, but they would have to submit a new development application.
Would it be possible to get a list of those particular ones that are still in process and might have the option, should they choose to take it?
Yes.
To fall under this? Thank you. And where they are, not just the names. So I can be, should I set you up for success? Thank you.
Go ahead, Ms. Fiedler.
One follow-up question. I might have more, but I'll do the rest offline. This is, if an applicant applies for an administrative change, when the county is presenting their case, if it were to be in the Severna Park Marketplace area, would the plan, Region 4 plan be referenced and the study be referenced?
Yes, it definitely would. And I, again, I don't want to speak out of turn, but being familiar with that plan, I believe that if an application came in, our office writes a staff report with staff recommendations on every administrative rezoning application, and I don't think that our staff report would recommend in support of a rezoning if we knew that that plan provision had not been addressed yet.
Okay, thank you.
Thank you. I'll just take a quick minute on this. Can you elaborate a little bit on the concern or issue between Bill 2024-75-24 and then 72-24? I did a cursory, I tried to figure out, because Mr. Hunt had mentioned that there were some concerns. I tried to figure out what they were, but that would be really helpful.
Well, I think the main concern, Ms. Pickard, is that the bill, I don't believe the bill is introduced, is drafted correctly, because it says under 188302A, it says that except for development on a site located in the BWI Fort Meade area, you have to meet this new mixed-use requirement of having at least one use from two different categories. That could work, but that doesn't carry over the full intent of Bill 2024. Bill 2024 accepted mixed-use sites in the BWI Fort Meade area from the current mixed-use requirements, but it only did that if they were going to replace those non-residential mixed-use requirements with multifamily, and it also had an affordable housing component attached to it. So those got sort of dropped from this bill. And even though I think by next summer, since every project is going to have an MPD requirement, that may be less of an issue, we felt that in that interim in between, you know, if the intent of Bill 2024 was for these projects to include that affordability component and for it to be multifamily only, then we should probably carry that over into this bill. I don't know if that makes sense. I don't know if Ms. Kenny wants to help me. It's a little confusing, I know.
No, I don't have much to add. I think that really what we're doing with the amendment is just adding back in some language from Bill 2024 that was inadvertently taken out, as Ms. Miller had indicated.
Okay. I didn't see how that, I mean, in the code, it doesn't seem to be acknowledged in Bill 7524, but it also doesn't seem to be repealed. Does that make sense? Like it seems to, isn't it 1810 something?
Well, the language in 188302 that was put into place by Bill 2024 would be repealed because this bill actually repeals and reenacts all of that subtitle. So 188302 is reinstated here in 7524. So that's why the language that was put into the code under Bill 2024 was actually not addressed completely in this bill. So it doesn't have that tie-in to 1810 125 anymore. That's what we'd be adding back in.
Okay. Okay. I mean, this is y'all's bill, so this doesn't have Pickard's name on it at all. One of the things that we're coming up against in the council is the fact that our code supplements are not up to date, and that's a contract that is executed and managed by the Office of Law. So we really do need to work on that with American Legal so that we can all be drafting from a current code. I think that would also be helpful, rather than having to cross-reference bills that aren't in the online code. Does anyone else have any questions for Bill 7524? Mr. Smith.
I'll be quick. Yeah, if we can set up a virtual meeting, because I definitely want to deep dive. I'll be honest, I'm not 100% fan of this bill because we're going through the zoning process now, and I think I feel like that's where the proper place for this type of activity is, but that's my own personal 2 cents. But there's certainly some activities that I'm interested in learning, the catalyst that really sort of push this specific bill. So I'll just put that on the record. Thank you.
Got it.
So just in managing council time and legislation, we'll have at least 1 or 2 amendments ready
I
Monday nights?
anticipate having at least 1 or 2 ready. If not, we'll ask for a hold. But
Okay.
I would like to have 1 or 2 ready. Yep.
That would be helpful. As you know, most of District 2 is in Region 3. I'm eager to see modernization to our mixed-use code before I'm in a situation where things have to get administratively rezoned. So I hope we can work through and bring consensus and a modernization to our mixed-use code here with this bill. So without any further questions, we can move on to Bill 7624. Ms. Fiedler, this is your bill.
Thank you, Madam Chair. This is a cleanup bill to the original MA1 bill. The issue was I actually identified when that bill was in discussion and passed, but I really felt it necessary to have the MA1B be a legal zone while we were discussing comp rezoning. So I committed to coming back because the way that the MA1B bill is written, it does allow for a marina caretaker's dwelling to be larger than the primary dwelling, and that was never the intent. So this states that it is smaller than the primary dwelling, and I will have an amendment to actually reduce and restrict it even further to be closer in line with our 80 ADU square footage.
Administration.
Ethan Hunt from the administration. I have the same team with me at the table. Happy to answer any questions.
Do y'all have any thoughts on Ms. Fiedler's bill?
We're comfortable with it. I know we had sent some feedback, so.
Okay.
Yeah, and I would just add that originally it was thought that the acreage maximum limitation of 3 acres would really restrict the size of a secondary dwelling. But knowing that every property is unique, I suppose that you could have a situation where there's a larger marina caretaker's dwelling. So this just ensures that we don't have a secondary, not primary dwelling unit that's bigger than the primary.
Okay. We have covered 7724. We'll move ahead to 7824. Mr. Hunt, this is y'all's bill.
Thank you, Madam Chair. Ethan Hunt for the administration. I think Lynn is still here. This road front. Oh, Sarah Fowler, sorry, from the Office of Planning and Zoning. I think we have some folks from DPW as well, David Braun, maybe Raghu Badami. So this bill proposes an update to the road design requirements to clarify when right-of-way dedication and road frontage improvements are required for new developments. And it also clarifies design and declaration requirements for private roads. Happy to answer any questions or turn it over to OPZ staff.
Well, Ms. Fallio, since y'all are here, would you care to elaborate on the intent of the bill? That would be helpful for the council, I think.
The intent is basically for new developments and redevelopments to improve the roads that they are touching. So along their frontage, to improve sidewalk, road width, and provide right-of-way dedication. It also cleans up some of the private road language. Basically it.
Okay.
Good morning, David Braun with Public Works. The one thing I would like to add is that the frontage issue here that we're talking about and a couple other things we've added into this bill were actually part of the code up until the 2009 rewrite, when they were left out of it at that point for some reason or another. And since that time, for a period of time after that, they were still being implemented on projects as they were going through the process until it was identified a few years ago that these steps weren't in the code anymore to be able to do for frontage improvements especially. So that's part of the reason for getting it back in there. When it was part of the code, there wasn't any real pushback from the development community to provide those improvements. And they acknowledged that, and we're still working with everybody to do that, even after it wasn't in the code anymore until the decision was made to stop enforcing it from the county side.
Okay. So, Ms. Fiedler.
Two questions. First, this does not apply to state highway. It's only county roads and private roads.
It would require improvements to state highway following state standards, not county standards. So if they had a need for widening or sidewalk or whatever, they would be able to require it. We would work with them to figure out what that was and require it as well.
Yeah, the state gets a lot of other folks to pay for their roads, don't they? Second question are there specific examples of why this bill is necessary? I'm a visual person, so I'm trying to visualize what this will do and improve in the process.
I actually have a terrific example. If you look at St. Martin's Lane, just take a cruise down on an aerial photo at some point. You can see where some of these properties have improved, others haven't, and there's kids walking along an unimproved road to get to the bus stop. And the sidewalk puts down multiple times. And so this would just have all of those required improvements, lane widening, sidewalk, and everything, just done incrementally by developers instead of the county having to come back in later and fix it and improve it.
And that's St. Martin's Lane.
St. Martin's Lane is a good example, yes.
Okay, I know that one. Thank you.
I understand that to a certain extent, but if you're going to have a development on only one part of a road, there's still going to be a sidewalk to nowhere. Like, you're not going to then come in behind and force property that is not being improved to add sidewalk.
Correct. It's an incremental improvement, and then that reduces the load on DPW to do those improvements in the future.
Mm-hmm. And can you talk about the concept of improvements to the center of the road? Does that sort of get us improving half of the width of a road?
Sometimes it can be to wherever the center line is. So that may be a little bit of shoulder widening or sidewalk on one side of the road. We can't force, I don't want to speak for law. Generally, that's their responsibility to the center of the road, and then someone across the road can also do those improvements in the future.
Okay. Ms. Fiedler.
Thank you, Madam Chair. Are historical roads exempt?
Yes, I believe so.
I'm not seeing it here, but
Scenic and historic is managed in a separate thing, and it only requires improvements where necessary for safety. So that would override this part.
Okay, got it. Thank you.
Okay. I mean, I've certainly had small businesses that were intensifying their use or being then subject to creating sidewalk for, which then, really does exacerbate their investment in their property, certainly on roads that aren't necessarily walkable in any other place. So I just want to make sure that we're not adding a burden to some of our small businesses and having to put 50 feet or 100 yards of sidewalk on a commercial road that doesn't have any anywhere else. It is a burden to small businesses, absolutely, for sure. So I'm just trying to understand the catalyst for the bill. I mean, sidewalks are also incredibly important where we have full stretches of sidewalk and pedestrians in between school to community connections and things like that. But we do need to be mindful of some of the burdens we place on small businesses. So I will continue to read this bill. Any other questions about 7824? Thank you. 7924, police grade reallocations is also the administration.
Ethan Hunt for the administration. With me at the table, I have Lori Blair Klossmeyer from the Office of Law, Ann Badowski, Jackie Atkinson, and Sarah Heffernan from the Office of Personnel. So under County Code, Section 61202C2, the County Council shall approve any pay grade changes to the classification plan that are 10% or greater. This bill makes two classification plan changes within the police department. The first change is a grade reallocation of the evidence coordinator leader classification from NR 16 to NR 18, which impacts one position that is currently filled. The second is a vacant position reclassification, changes an administrative assistant 2, which is OS 4, to a management aide, which is NR 12. It does not increase position count. It exchanges one classification for another, and decreases one administrative assistant 2 and increases one management aide. We're happy to answer any questions.
Any questions for the administration on Bill 7924? Ms. Badowski, did you want to add anything since you've been sitting in the audience?
Good morning. I just wanted to say that this is an outcome of Bill 424 earlier on the personnel reform that we did, where some of our reclassifications would still come before the council. And so this is your first one.
So this is something the council asked for, and now we need to read a bill. Okay, good to know. I don't see any questions of my colleagues, so we'll make sure we're prepared on the first public hearing. Moving right along, Bill 80-24. This is actually my bill. We're calling it the Utility Connection Fee Bill, it looks like. This is in regard to the state housing bills that passed and go into effect January 1st. For nonprofit developers that build affordable units, which we're considering 60% AMI and below, by state designation, state code can then receive a 30% density bonus if they provide 25% of their units as affordable, meaning 60% AMI and below. So we do have some small scatter site nonprofit developers that are interested in that bill going into effect and taking advantage in Anne Arundel County, and with that they would like parity to their other programs like workforce housing, and they would like to receive the 50% connection fee reduction. That's for those 25% of the units. How'd I do?
I think that's it.
Okay.
I got it.
Thoughts?
So Ethan Hunt, on behalf of the administration, I have Karen Henry from DPW and Kelly Kenny from the Office of Law. Administration supports this bill. We're happy to answer any questions.
Are there any questions? Mr. Smith?
No question, just co-sponsor.
Oh, thank you. That's nice.
Noted. Thank you, Mr. Smith.
Wait.
I'd like to co-sponsor too. In fact, I was just typing an email saying, please add me as a co-sponsor. Thank you.
Thank you, Ms. Summer.
Thank you. We're almost there. Mr. Rod being left. I appreciate it. This has, I have not done any further work looking at the way the state law that has changed will go into effect in July. If there's any other areas with that the county needs to be contemplating, but I'm sure as that COMAR goes into effect, we'll start to see if we need to shore up our code. Thank you for being here, Ms. Henry. We will now, Bill 8124, conditional uses. That is also my bill. Let me get myself together on that. This bill introduces new uses into the code: EV, vehicle repair, towing, and storage. It adds, currently, Ms. Miller can correct me if I'm wrong. Currently, vehicle repair and mechanic shops and things like that are allowed in our highest commercial zones because they're a little noisy and they're a little smelly and messy. EV vehicle repair, in its when it's solely done, we're going to start seeing our EV vehicles coming out of that warranty periods with, so dealers, we are seeing already and going to see more EV vehicle repair done outside of dealerships. So acknowledging that they are a different animal, so to speak, than regular vehicle repair, this bill contemplates where they would be appropriate. Would the administration like to? Mr. Hunt.
Certainly. Ethan Hunt for the administration. With me, I have Lynn Miller from the Office of Planning and Zoning and Lori Blair-Klossmeyer from the Office of Law. And I'm going to turn it over to Ms. Miller because I know she did have a couple questions that she wanted to discuss.
Sure, Lynn Miller. Yeah, we don't have issues with the intent of the bill. And I know Councilwoman Pickard answered some of our questions by email, which explain more about the tent, so thank you. I think the only other, there probably are a couple of amendments that we would recommend.
Mm-hmm.
One would be to add the commercial district use chart and to list this new EV use specifically in the C4 district, so that it's clear, since this bill is now sort of distinguishing that from auto. And then we would probably also recommend for the use that involves towing and storage to specify that it's temporary storage not to exceed 90 days. That's a standard clause that we use in our auto towing use, just because in the past we have had enforcement issues with lots becoming permanent dumping grounds for vehicles.
Sure.
So I think with those two amendments, it would make, it makes sense, and we would be comfortable with the bill.
Fantastic. I appreciate the questions and the opportunity to have that exchange, and I do not oppose either of those amendments, and we will work on those for Monday night. It makes sense. I do typically like to have my bills sent to you prior to introduction, but that just didn't happen this time, so we'll have to make some amendments.
Your amendments would be needed for the November 4th meeting, not for Monday.
Oh, good. That's helpful. See? All right. Okay. Okay. No need to stress about that then. If there are any questions, Ms. Ledbetter.
Just for those that might be watching at home or following along, this is specific to zoning. So folks who might have concerns about fire safety for these facilities is handled in a completely different. It's not going to be in the zoning section of code.
Correct.
Thank you.
Okay. Well, with no further questions, we'll move on to Bill, whatever's next. Where did I put my stuff? $8224, Mr. Smith.
All right, this bill is basically to come back to the table for some relief for some of the veterans that live in the county. I've had several emails over the last probably two years, even before when this bill went into effect. I know we capped it at the 500 previously, but it really hasn't made any impact to the larger veterans population. In fact, I think this more recent one, something less than 200 people even were even taking use of it because they were sort of, some of the other homeowners, the price of the home is right at that level where if it's over, they can't even qualify for it. So it puts them at a disadvantage. And I've looked on the market, and I have some examples for that, certainly at the public hearing, to show you the types of homes that are literally $501,000 now here in Anne Arundel County. And you say, wow, that's $500,000 plus. And so the goal is to at least provide some relief to those folks so we can actually impact a larger population set of the veteran community. So that's where this derived from. Told them I would come back to it if it did before, if it didn't have any meaningful impact, and here I am trying to do that. So thank you.
Does the administration have any comments on Bill 82-24?
Thank you, Madam Chair. Ethan Hunt for the administration. With me at the table, I have Brian Schenk from the Office of Finance and Kelly Kenny from the Office of Law. And we're happy to answer any questions.
Okay. Any questions? Any comments since you waited? I mean, do you have any thoughts on the bill or its
Brian Schenk, Tax Billing Manager for Anne Arundel County Office of Finance. I think appreciate Mr. Smith's standpoint. That's one of the most difficult conversations our office has sometimes with the retired veterans, is that they find out that their property, due to the phase-in assessment process, 1 year is eligible and then the very next year is no longer eligible. So I think that'll help ease some of our conversations with this population.
Do any of our other tax credit programs also cap income required in relationship to the qualification?
Yes, Ms. Pickard, the disabled veterans tax credit that the county offers, which is different from the state's exemption, also has a income component to it. It's $100,000 gross for the qualifying person. So, for example, single individual would have to demonstrate that they're under $100,000 for their gross income. For a married couple, they'd have to identify whose income meets the criteria versus the other person's does not.
So in a two-person household, the household income is taken into consideration, or they're the veterans?
Just the single qualifying veterans, ma'am.
I see. Okay. Okay. I know we had Miss Rodvian's not here, but we had that conversation about the applicability. I was just curious. Thank you. Does anyone else have any questions about Bill 82-24?
And just for clarity, I do not qualify for this benefit, just to put that on record. So I'm going to think, because someone had asked, and I was like, yeah, I'm a reservist, but I'm not retired, don't have any of these benefits. So just clarifying that.
All right, we'll move along to Resolution 39-24, the MS4 plan. This is the administration's bill. You have the floor.
Thank you, Madam Chair. Ethan Hunt for the administration. With me at the table, I have Eric Michelson from the Department of Public Works and Kelly Kenny from the Office of Law. And I'm going to turn it over to Eric, if that's okay, to just briefly explain what this resolution is. It's required by state law.
Okay. The Maryland Department of the Environment, Eric Michelson, Deputy Director, Department of Public Works. The Maryland Department of the Environment requires that every 2 years, MS4 permit holders, stormwater permit holders, essentially provide this financial assurance plan to them to demonstrate that the jurisdiction has the financial wherewithal to achieve the goals laid out in the permit. And so for the past 6 or 7 years, we've completed these without issue and had satisfaction with MDE. This is our latest iteration. We're currently about halfway through our current MS4 permit, and as you've read, if you've read through the executive summary, the county has demonstrated the capacity to be able to cover its costs for this permit and is also laid out a pathway to be able to achieve compliance towards future permits over the coming fiscal years.
Do we have any questions for Mr. Michelson, who's been waiting so patiently? Well done.
Thank you.
The executive summary seems to cover it all. All right, last piece of business before the council today is Resolution 40-24, the MEDAF-PWRQ. So.
Certainly. Thank you, Madam Chair. Ethan Hunt for the administration. With me at the table, I have Wes McQuillan representing the Economic Development Corporation and Lori Blair Klossmeyer from the Office of Law. So the MEDAF stands for the Maryland Economic Development Assistance Fund, and PWQ is Power PWRQ. Okay. They manufacture panel boards and switches for various industries such as hyperscale and computing, renewables, electric vehicle infrastructure, healthcare and pharmaceuticals, transportation and transit. They're expanding their headquarters and manufacturing operations in Anne Arundel County. They currently operate out of a 32,000 square foot facility located at 7235 Standard Drive in Hanover. And they are going to be leasing an additional 155,000 square foot facility at 7200 Standard Drive. They will be retaining their existing 34 full-time employees and will also be hiring an additional 160 full-time employees for a total of 194 full-time employees by the end of December 2029. And the total cost of this project is estimated to be $8.8 million. To support this expansion, Anne Arundel County Economic Development Corporation has been working with the Maryland Department of Commerce, which agreed to provide a conditional loan to Power PWRQ from the Maryland Economic Development Assistance Fund, MEDAF. The state loan is in the amount of $780,000. In order for the company to receive this loan, the state requires that the county through EDC provide a 10% match. And the state also requires the county to pass a council resolution confirming that the county supports the state and county's assistance. So Anne Arundel Economic Development Corporation will provide a 10% match of $78,000 in the form of a conditional loan if Power PWRQ invests the amount of capital that they estimate they are going to and hire the number of employees estimated by the end of December 2029. The loan will be converted into a grant. EDC has included funding for this project in their current budget. The funds will be used for machinery, equipment, furniture, fixtures, tenant improvements, and other associated costs at the new facility located at 7200 Standard Drive. We're happy to answer any questions.
Mr. McQuillan, did you want to add anything?
I don't have anything to add, but I just wanted to just clarify that this is AAEC money, not county money. And we're only here doing this. As much as I love seeing all 7 of you, it's because it's required by the state. I think other jurisdictions that are under county government have to go to county council to ask for approval to spend the money. That's not the case here, but the state likes to have acknowledgement that the state is working in our county and spending money in our county. So we appreciate your support on this.
Okay, any questions from my colleagues on Resolution 40-24? I'll leave the acronyms to Mr. Hunt.
A lot.
I'll continue to butcher them.
All right, well, thank you for being here. Is there any other business any council member would like to bring before the council at this time? Seeing none, may I have a motion to adjourn?
Ledbetter, so moved.
Second.
All in favor? Aye. The county council is adjourned until Monday, October 21st, 2024 at 7 p.m. for our next legislative session here in our chambers. Thank you. Have a great day, everybody.